Paul, are you okay if I commence?
Yes, Karen, please.
Okay, members, you are hereby summoned to attend the virtual meeting of the Health and Community Committee on Thursday, the 17th of June, 2021 at 4 p.m. I'll commence just with the attendance. So Alderman Devaney,
Karen.
Alderman Guy,
Karen.
Alderman Kerrigan,
Here, Karen.
Councillor Boyle,
Sure, Karen. Yeah.
Councillor Burke,
Sure, Karen.
Councillor Carr, Councillor Duffy, Councillor Edwards,
And sure, Karen.
Councillor Farrell,
Here.
Councillor Ferguson,
Here, Karen.
Councillor Fleming,
And sure, Karen.
and Councillor Harkin.
Here.
Councillor Sonoya Barr
Here.
and Councillor Taney. Okay, thank you.
Thanking you, Karen, and a big welcome to everybody to the Health and Communities meeting. If I could read the statement for remote meetings as we do on each of these occasions. I would like to remind everyone who is in remote attendance that this meeting will be broadcast live via the Council's YouTube channel and will be available for viewing by the public and the media. The broadcast will also be available for repeated viewing at a later date. This broadcast may be terminated or suspended in accordance with Council protocol. Members and approved speakers are reminded to only have their mics and cameras on while speaking at the meeting, and to use the chat facility to highlight a request to speak. By participating in this meeting, you're consenting to being filmed and to the use and storage of those images for broadcasting or training purposes, and for the purpose of keeping historical records and making those records available to the public. A copy of the Council privacy notice may be found on the Council website, www.derrystrabane.com. Folks, in terms of declaration of members' interests, it can either be made now or as the meeting goes on, or to put them in the chat box, please. And on your behalf, folks, I would like to welcome a deputation from, in terms of to deal with the Western Urgent Care, and welcome on your behalf, Dr. Lee Casey, Medical Manager, and Miss Deborah Ward, General Manager. So if I could hand it over to your two selves for the presentation, and then obviously open it up to councillors and aldermen. Okay, thanks.
Good afternoon. I hope everyone can hear me clearly. My name is Deborah Ward, and I'm the General Manager for Western Urgent Care, the GP out of our service that covers the Derry, Tyrone, Fermanagh counties. Apologies, my colleague, Dr. Lee Casey, is one of our medical managers. He's just having a couple of problems there with his IT, so I do hope he can join me, but he's agreed that I can proceed with the presentation in his absence until he gets his difficulty sorted there. So apologies about that. So in terms of the presentation, I know you've received a copy of that in advance in terms of just to answer some of the questions that was put to us in the correspondence that we received there some time ago. And thank you very much for Lorraine for coordinating everything for us as well to get that sorted out. So we've just provided a brief summary there in terms of how the service works, just so that everybody's aware of that. And then to sort of breaking it down into some of the current pressures facing the service and some of our plans to address those issues as well. So in terms of how the service works, we're an urgent medical service to meet the needs of the patients of GPs in the local area when the GP services is closed. So in terms of hours of operation, we would work from 6 p.m. on weekday evenings till 8:30 the next morning. And on weekends and bank holidays, we provide a 24-hour service. So on each evening, we would have GPs and clinical staff working in the bases in Derry, which is currently based at Great James's Street, ordinarily based over in Galvin, but due to COVID, we relocated. We also work on evenings in Strabane Health Centre, Limavady Health Centre, and then we have facilities as well down at Oma Hospital and at normally we're based at Southwest Hospital in Enniskillen, but again, because of COVID, we've relocated from there over to Lakeside Health Centre temporarily. What we operate is, as I say, it's an urgent medical service. We operate a telephone triage model. So when the patients come to the service and they're trying to, sorry, it's the next slide there. When the patients contact the service, their details and information is taken by a call handler, and then that system sits in a queue, and that queue is accessed then in the back room by nurses who would work across any of our 5 bases or even here from our call centre in Derry, and they would manage those calls on the basis of their clinical priority. Obviously, we would, in some cases, take some what we would call acute calls, which would be emergency cases. The majority would be urgent, and then we would also accept routine calls as well. And depending upon how quickly we can get through the urgents, we would also then work through the routine calls as well. In terms of the bases that we work from, we do not operate a walk-in clinic in any of those bases. So patients must telephone first and be triaged to understand whether they actually need to come to the urgent care centre for ourselves and the out of hours, or if they need to actually maybe be prioritised and go to A&E, or in some cases what we can do, and it happens in about more than 50% of our calls is actually dealt with by the nurses and the GPs and the pharmacists, and that when they triage the calls, and those calls are concluded at that point with the advice that's given to the patient at that time. So just there on that next slide, you can see something about the pressures that we're currently facing. And these is pressures that's being faced by out of our services across Northern Ireland, and I'm sure some of you might have heard about the current pressures that's existing up in Belfast in the past couple of weekends there. They're currently at a position where we were about 4 or 5 years ago in terms of capacity up there, but there's been a significant decline in the number of GPs working within the local area. Over the past few years, we've had a decrease in the number of GPs working, and that has resulted in a number of practices actually merging. And there's a number of GPs available in the practices, and the practices themselves are doing what we do in terms of trying to skill mix to attract additional clinical resource into their facilities. Obviously, there's the demands of the in-hours work as well, and that would impact upon the capacity for GPs to work in the hours period. And obviously, with any of us really, we all like to have a good work-life balance, and we can understand that. There's a misunderstanding as well in terms of out of hours work. Many years ago, it would have been the case of a GP or a practice itself would take care of its own patients during the out of hours period. If someone was ill and needed home visits and needed care, that's no longer the case. GPs are no longer contractually obliged since about 2008 to be responsible for the care of their own patients. So GPs, if they wish to work, they do that voluntarily, and obviously they're paid for that, but it's for them to make their own decision if they wish to work during the out of hours period. There's been a number of other issues as well in terms of the processes around GPs working. Until April 2018, any GP who worked on the out of hours basis was actually considered a self-employed. Now, at that point, we probably had about 10 GPs who were contracted to us and would have had a rota of certain shifts. At the minute, we're down to about 6 GPs who are contracted with us, and the rest are what we would call as and when or sessional GPs. But then in April 2016, they were no longer classed as self-employed, and therefore things like their tax and national insurance and everything was deducted at source rather than them to pay that later. So that was one of the issues that we have. There's also an issue which been well documented as well recently around pension caps. And obviously, once the GP hits a certain level of income, there's actually caps then about how much more work that they could do before they actually get financial penalties put under their pension and put on their income. So that for some has been a deterrent as well. And then the last issue there is just about the rising indemnity costs. Because the GPs, any GP that wants to work, they have to pay for their own indemnity, whether they're doing it in hours or out of hours work. And we've had reports of GPs receiving bills for over £20,000 of a cost just for their indemnity, which is their insurance. And obviously for anyone that needs to work, that's a significant cost for them that they would have to recover in terms of meeting that. So, and sometimes you can imagine that's quite a considerable amount of work to be done before they actually start to earn or see the benefit of that income. So there's been those different factors that face not just ourselves, but also the out of hours in other parts of the province and across the water as well. So sorry, Lorraine, can you please move on there? Thank you. And obviously more recently, and I don't want to labour the point about the impact of COVID-19, but obviously those issues in terms of GPs being available to work, their focus on their patients and their own practices. There's obviously been the additional issues where they have to cover the work within the COVID centre, which has been based over there at Altnagelvin. That's drawn clinicians from individual practice to the COVID centre on a daily basis. And then more recently, the amount and the capacity that they've had for doing the COVID vaccinations within their own practices or within the GP Federation hubs that we've had. Obviously, everyone's trying to ensure that the clinically urgent patients have been prioritised. But what we always have to bear in mind that is if a patient got into a base, and there has been guidance issued to all the practices in relation to this about the management of patients coming into bases who might have COVID symptoms. I know on one instance, we brought a patient into the Derry base and we had it closed down for over 4 hours because it was then expected or sort of diagnosed that that patient did have COVID. So then that meant a 4-hour lockdown there for us just because we needed to get specialist staff and ensure that the room and the waiting area and everything was appropriately cleaned down. So that had a knock-on effect then for other patients. So everyone does what we can in terms of triaging the patients and making sure that the patients are being brought into a clean environment in that regard. But one of the benefits from COVID is that it has moved us on in terms of some of the new ways of working that we've been looking at. We have introduced more video consultations, and we have found for a lot of patients they've been quite happy with that arrangement during COVID on the basis that they actually were able to see a clinician, a GP face-to-face or an advanced nurse practitioner. They can see them face-to-face and they can discuss their condition with them. The issue has been then that they haven't had to actually sit in a room with them. And obviously for patients who've been shielding and isolating, that's been a good benefit for them. And we've had positive feedback in relation to that. I suppose one of the things that we've been looking at is the skill mixing. Sorry, Lorraine, it's the next slide, please. One of the things we've been looking at is the skill mixing of our workforce. Not every patient who contacts the service does need to see a GP. We have some very highly qualified advanced nurse practitioners who are eligible through their qualifications and skills to prescribe to patients. And they can also see patients in relation to their mental health issues or gynae issues or paediatric patients, so children. So we have some very skilled advanced nurse practitioners there. We also have specialist nurses who are also eligible and are qualified to prescribe to patients. And if someone's looking for repeat medications or it's a condition that they already have and it's something that's been long-standing with them, or even it could be a new condition as well, but they are able to deal with those patients and close that case in terms of providing whatever care or medication the patient might need. We've actually employed an advanced paramedic since last year. We have someone who's with us now, but has over 20 years with the local ambulance service, and is currently also doing her prescribing medication. So she's qualified to a master's standard, but is also able to see patients coming into the base and deal with things even like minor ailments, which is a benefit to us and avoids patients having to go to the ED. Prescribing pharmacists as well. If someone's looking for repeat medications, our pharmacists can deal with those and work with those. It's particularly someone who's looking for repeat medications. There's no point in a doctor dealing with that. When what we're trying to do is actually put the patient in front of the most appropriate person that can deal with their care and their needs at that time. And as I say, our nurse advisors, we're very fortunate. In Northern Ireland, we employ the most nurse advisors, and our peers in the other areas are actually quite envious in some ways of the amount and the experience that our nurse advisors have, because they don't have that. And I think that's one of the issues that they might have in other areas, is they struggle then when the GPs is coming in other areas. They have to balance between seeing the patients and doing the triage. So just on the final slide there, please. The next slide, please, Lorraine. So in terms of our plans for the future, we're still looking at recruiting for additional staff. We've been very fortunate recently in terms of indemnity, by the fact that we've now been able to arrange what is considered Crown indemnity. So therefore GPs do not need to arrange their own individual indemnity for working in the GP out of our service. So I'm sure you can imagine that'll be a significant saving for many of them. And we've actually had GPs come and looking to work for us that haven't worked for us now for a number of years, or have even worked for us before, because they no longer have that additional cost. We've actually had a few more coming looking to work for us recently, which is we're seeing as a positive benefit to us from that. So that helps with our staff recruitment. But we're continuing to work away as well in terms of the advanced nurse practitioners and specialist nurses, and we're actually training some of those ourselves and sponsoring them through their additional education through the local universities as well, to ensure that we can actually build our own workforce for the future, and we can remain as a sustainable and continue to operate. One of the things will be we're relocating back to our existing bases at Altnagelvin and Swa sites. We're expecting to do that in the next few weeks. And then in terms of innovation and quality projects, prior to COVID, we had some ideas in terms of how could we meet the needs of some of the care groups and some of the specific groups that we're looking at. So in particular, we would usually get a lot of calls from nursing home and care homes. So we're actually looking at what we can do with those specific groups as well to manage their care and their needs. I'm sure you can imagine some of our doctors or the nurses would go on to the nursing homes, and they might go on to visit one patient, but then they're actually asked to see maybe a few more. So obviously we're looking at what we can do in terms of all those arrangements and the support we can offer to those groups. But that links to work that the trust is doing as well with those services as well. So there's quite a bit there. So we're keeping plugging at keeping the GPs coming in to work, because obviously as a GP out of our service, the patients have an expectation that they'll see a GP. But what we're continuing to push back to them is a GP might not necessarily be what you need to see, and there's other ways that we can meet their needs, and that's what we're continuing to try to do. So I don't know if anyone has any questions there that they might want to put to me. I'm sorry, apologies, Dr. Casey. It doesn't look like he's been able to join there. I haven't seen his name or anything coming up there to see if he's been able to join us. But I don't know if anyone has any particular questions or any things they might want to flag at this point.
Deborah, as chair, if I could thank you for your presentation and your insight, and just suggest to you that so far there's 4 councillors looking to come in to speak, and if you don't mind, I'll maybe take them in batches or take the 4, and then if Michelle wants to come back in relation to what they may raise, whatever. So if I could start with Councillor Edwards. Stephen, please.
Chair, thanks for letting me in, and I want to take this opportunity to wish you well as the new chair of this committee in the year ahead. I'm sure you'll do a fantastic job, so just wanted to make those comments from the outset. I want to thank Deborah for her presentation, and also for all our GPs who've worked tirelessly under intolerable conditions throughout the pandemic. I know it hasn't been easy for them, but I think it's important that that's put on the record today. And the GP out of hours service is vital. It's a vital local service, and my comments, unsurprisingly, will surround the wider Strabane service. And I know, Deborah, that you have been working hard since you took on your role with Western Urgent Care, and I know it hasn't been easy at times either. I know that there's been issues around staffing, especially in Strabane, even before COVID, and there is concern among the community that the service in Strabane probably isn't what it used to be. But as you've mentioned in your presentation, it is good to see that the work that you have been doing around having nurses and especially prescribing pharmacists and other healthcare staff brought in to sort of bolster the service locally. I think that's been successful. And I know that there is a massive issue, as you raised in your presentation, around the recruitment of GPs across North. And it would be my hope that a medical school in Derry would go or help a bit in that in a way, hopefully, in the future. But in terms of questions, I would just like to ask Deborah, does she believe that the Health and Social Care Board could be doing anything else, probably regionally and locally, to maybe try and help improve the out-of-hours services? And can I also ask whether she can confirm that there are no plans to downgrade or remove the out-of-hours service in Strabane town, because it's a massive concern for local people. I do get contacted regularly about it, so I'd appreciate if she's able to answer that, and I really thank her for coming into the committee today. Thank you, Chair.
Thank you, Stephen. If I could also ask Councillor Barr Raymond.
Thank you, Chair, and I also wish you well on the year ahead and your position as Chair. Thank you for the presentation, Deborah. Deborah, will it be fair to say that the demands of an hour's work would not be a big issue at the moment with GPs? When you look at the fact that face-to-face meetings with patients has been greatly reduced, and the problem is mainly a question of GPs choosing not to work out of hours. In which case, I feel that there should be a statutory compulsory onus on GPs to do a percentage of hours work. As Councillor Edwards alluded to there, the problem with out of hours provision in Strabane has been a problem for a number of years, and again, as Councillor Edwards says, there's a worry it will eventually be withdrawn. Thank you, Deborah.
And if I could ask Councillor Duffy, Sandra, please.
Thank you, Chair, and also our good wishes on the year ahead, Paul. Well, we're behind you 100% from afar.
Thank you.
But Deborah, thank you very much for the presentation, and it was great to get the presentation in advance so that you were able to absorb some of the information in it. It was really informative. I have to say it's really undoubtable the pressures that Jews are under in terms of the out-of-hours service. And that's before we even talk about COVID and the pressures that have come with that as well. The service has always been an excellent service, but I suppose, just as Councillor Barr has alluded to there, some of the issues that we have been picking up from our constituents is around the inability that they feel to get face-to-face services with the GP, particularly with our elderly population who feel that they need that face-to-face interaction with someone, and it is very difficult at times to be dealing with an elderly person who feels that they didn't get the service that they needed at that time. So that's probably one of the main issues that is coming through to us regarding GPs and the way things are working. And we know the pressures that have come with COVID and the reasons behind it. But if you are an elderly lady, for example, who wants to see their GP, it's difficult for them to understand and deal with it. I wanted to just comment then on the contractual arrangements for the GPs to work out of hours. I think that is causing a real deficit in an already stretched system. And I was just, I suppose, wondering, does the GP Federation themselves have any solutions that they're working on how to address that? So I suppose that's the first question I would have. And then Councillor Edwards, he alluded to it there in terms of the medical school. We do have the medical school coming online now in the autumn, and we're hopeful that that will address some of the deficit that we have locally regarding GPs and staying in the area and working in the area. Do you have any sort of data that the Jews are looking at in terms of how quickly that medical school being up and running will have an impact on the ground in terms of getting GPs on the ground to see people? I suppose then just around the medical hubs at Fort George and Strabane, have you any idea in terms of the impact they may have on GP services right across the city and district? Because they are something that we are looking at. I really welcome the fact that they're coming on board and the multidisciplinary teams that you've alluded to that work really well and have been really successful. how will that impact then on GP services? But look, just going to finish off on what I started off with in terms of the face-to-face appointments. That is the main thing that we are getting. And I suppose probably as we're seeing people being more and more vaccinated, will we see a return, or how soon can we see a return to more face-to-face appointments for people? But thank you again for the presentation.
And Deborah, if I could take one more in this batch, and then I'll come on to the second group. And if I could ask Councillor Doyle, Emmett, please.
Thank you, Chair, and just to be associated with the good wishes for yourself as well as in your head.
Thank you, Emmett.
Deborah, in terms of, well, I suppose two primary questions really, and it's, I've worked with the medical profession for a number of years previously, and out of hours was always a difficult one, particularly around the indemnification. I'm glad to hear that Crown indemnity has been secured, probably off the back of the federations as well. But in terms of, because this it was always a bone of contention over many years, especially with the primary care unit and Health and Social Care Board. Is there a roundabout figure in terms of the cost, or I suppose the payment to GPs for each session that they carry out as in out of hours? Because I know in previous years we weren't talking about hundreds, we were talking about thousands. So I'd be interested to know if you know what that figure is now. But primarily in terms of some of the staff that you've outlined, and I know a lot of people even from last night had contacted Western Urgent Care and have always received a fantastic service. Do you find, especially because of COVID at the moment, and what would the response be if, for example, you got calls around less physical health and more mental health? Do you find a lot of crisis calls from people in distress who maybe can't access services after hours in the normal processes that the trust, for example, provide? Thank you very much.
Okay, Deborah, if I could ask yourself maybe to address the first four, and then, as I say, there's another 4 councillors, older people looking to come in.
Yeah, thank you very much, and thank you very much for those kind words as well about the GP out of our service. Sorry, Dr. Casey's just joined me here, so he's just at the end of the table here beside me, so he might jump in as well in terms of responding to some of these questions. He didn't catch all of them, but I'm sure he'll be able to help if there's any issues. Just to sort of recap there in terms of Councillor Edwards, obviously you've noted there about the service that we have and everything else, and you've noted about the medical school. In terms of the support that we get from the Health and Social Care Board, they work with us day in, day out in terms of looking at the issues that we have, whether it's about the capacity of the GPs that we have, trying to encourage more GPs to work and everything else. And they have been instrumental in the work with us that we've been pushing for quite some time in terms of the Crown indemnity. We've pushed that in terms of one of the factors that is sort of deterred GPs from working in the out of hours service. So they have been working with us day in, day out on a range of issues prior to COVID and throughout COVID. And as I say, they've been significantly instrumental there in terms of assisting us with arranging that and getting that in place. So we do have to thank them for that. One of the other things that they are working with us on is in relation to the contractual issues with the GPs. All the providers and the management of the providers, we're all clear that obviously we know locally how many GPs would work for us in the local area. We've seen probably nearly a 50% reduction within the last 5 years in the number of GPs who do work in any of our 5 bases. But we can look at that and we know what's going on in terms of which practices would even ever have a GP. There's some GPs that have never worked in the out of hours service, and that's not any slight upon them in any way. Obviously, we understand about their balance and their other work and everything else, but we do know the numbers that are working for us, and they've been helping us. The board's been helping day in, day out to try to address that and do everything that they can in terms of that support to us. When we've been trying to develop plans for innovation and trying to improve quality, they've been right alongside us there in terms of support for that. And even in times arranging additional finances to try and assist us to get those things off the ground as well. I'll just pick up on the point there as well in terms of Strabane, and the same with Councillor Barr about the impact for the Strabane base. I know Councillor Barr, we've spoke as well previously just a few months ago about this, and I think it was even last year we had a meeting as well just in relation to it, about understanding the concerns, and we feel the concern as well about Strabane. But we would offer the shifts in Strabane every day. There's a shift on there every night. There's probably 3 shifts as well, 2 to 3 shifts, because we'd split the hours out on a Saturday and every Saturday and Sunday and on bank holidays. But if the GPs don't want to work, we can't force them. But at this point, there's no intention of removing anything from Strabane. Obviously, to do that would obviously be a significant impact, not just for our service, but the local area as well. But we have at no point at this time there's any plans for removing that service from there. So we still keep the services, we still keep our staff on there. So even if we have no GP there this evening, we would have a contract with our support staff for a driver and a call for a driver and a receptionist, and they'll still be on there this evening, even though we know that there's no work coming for them. That's our commitment to the base and to the staff that work there, and in some ways the local economy as well, in terms of keeping those staff there. So they're still there. Obviously we understand about there's been the decrease, and there's the demand as well for face-to-face, but we still have face-to-face appointments being offered to patients, and we'll continue to do that as well. So I think I've answered that one in terms of the commitment to out of hours and Strabane there, and obviously those shifts are still there. And as I say, there's no plans at this stage to downgrade the out of hours service there. In terms of Councillor Duffy, you had your question there about and you picked up about elderly care and everything else, but you had a question there about the contractual arrangements. As I say, we've been working with the board and continue to push this for some time about that there should be some element of a contractual commitment. Obviously, that would be significantly above my pay grade and everything else in terms of arranging that, because that would have to go through with the BMA and the GMC and the board and the department as well, the Department of Health, in relation to any changes to contracts. So there would be a significant piece of work on that, but I do know there's been conversations been going on for some time from all the providers to push for that to happen. We've even worked out, even if each practice was to commit only a small amount of hours each month, that would and to commit to work on the road, that would be a significant impact for us. A significant amount of our shifts would be filled on that basis, even if there was a commitment from each practice, even if it was pro rata based on the size of their registered practice, that would make a significant impact for us. The news about the medical school has been greatly welcomed. Obviously, I'm sure you're aware that once student doctors move into a local area, and this is the difficulty we have in this region, they usually settle in the Belfast area, and that's why there's quite a lot of GPs in that area, and they wouldn't have as significant problems maybe as ourselves for GPs and filling the shifts. So once they've settled in an area and they've finished their training and they've qualified and worked in hospitals, and then they have to do additional training to become GPs, we're hopeful that by the time they've spent a number of years actually working and studying at the medical school here in the city, that they'll have made their roots here, and therefore they would be seeking work here and committing to do that. But I think, sorry, Dr. Casey, it's about 10 years maybe before you would start to see them going through all their qualifications and their studies.
Yeah, for GP training, it's 9 years from qualification, and the medical, it's 5 years, sorry, 6 years from qualification, and then it's 4 years in the medical college. So
yeah, so it'll be about 10 years time once before the first group of students go through and are then actually qualified GPs, and therefore in the local workforce and in the local practices and things like that. So we've still, from our perspective, there's a bit of a gap between now and that point. So that's why we still have to look at all the other elements of the skill mix in the workforce. But by no means at all, not to underplay it, it is a significant bonus to us to see that coming into the local area. And we are very positive and very happy about that coming. In relation to the questions there about Fort George and the Strabane medical hubs, We are involved with our colleagues from the trust in terms of determining where our place would be within those facilities as well. Obviously, we're looking at that at the moment. We're based in the Strabane Health Centre. My understanding is the practices is there. The proposal is they'll move into that hub. We would class ourselves kind of like cuckoos, because we would work on an evening and things like that, and we would probably go on once the other GP practices leave. We can go on and use their facilities and then use that. So we wouldn't need maybe as much space as a practice in that regard, but we would be working with colleagues, and we are working with colleagues from the trust in relation to our place within those new facilities when they do open up. Obviously, at this point, we're still waiting, and there's still some of them around the planning process, or the plans and the bids have already been submitted to the department, and it might take some time for grounds actually broken on the work for those facilities. But we are involved in that work as well, and we would expect that it's with a lot of things, new facilities, new buildings like that do attract people as well to work. So we'd be positive about both of those changes in both areas, really. And the impact of what that would provide in terms of healthcare as well for patients can only be applauded, really, when that comes.
Thanking you, Deborah, and obviously welcome to Dr. Casey. And I have four more speakers, four more councillors who are looking to obviously speak with yourselves. And if I could ask Alderman Hussey, Derek. I'll come back. I thought I'd seen a thing there to say, I don't know, maybe in terms of his internet connection. But if I could move, and I'll come back to Derek. Councillor Boyle, Michaela, please.
Paul, Michaela is also having technical difficulties. The internet has gone off in her office, so she's working on it. So if you could come back to her.
Okay, if I could ask Councillor Ferguson, Rachel.
Thank you, Chair, and best wishes for your next term. Congratulations. I'm sure you are a dab hand at this point. Deborah, thank you very much for the presentation today. And I must say, can I just say thank you so much to yourself, Western Urgent Care, and everybody in the Out of Irish for the work that you do continually, not just during the pandemic, but before. You know, there was a huge stress on you, and I know it's been something that you have been battling for a long time. I think Councillor Duffy kind of touched on the question which I have, which is face-to-face appointments. Obviously, I have a lot of older residents who are concerned that they're not getting to see their GP face-to-face. They're being offered the technical options, you know, the video chat and stuff, and they don't feel confident enough. When they do get an appointment, it's more in the treatment rooms. So sometimes that, I think, spills over onto your shelves. So I'm just wondering if there is an option, if someone comes to your shelf distressed that they want to see someone in person and they don't want that, you know, kind of telephone query or video conferencing kind of appointment, are they able to see someone face to face? But I'll kind of keep it short and sweet. I really do appreciate the work in which you do. I think something that needs to be touched on possibly is the likes of a walk-in service, as well as yourselves and A&E and the GP practices, because I know you are all really overwhelmed currently and before the pandemic. But thank you very much.
Thank you, Rachel. If I could ask Councillor Harkin, Sean.
Thank you, Chair, for letting me in, and thank you, Deborah, for the presentation. And obviously, this is something that we've had many presentations, rightly so, from people in your field over the last couple of months, and so I would imagine that our knowledge has increased dramatically as a result of that. And I suppose, just following on, I mean, you know, you talked about the pressures that you're under in terms of trying to deliver a service right now, and we know from our side that people are very frustrated at their lack of ability to get services. And I think we're all now cognizant of the kind of out of control and unacceptable waiting lists that we have. And what I imagine is a lot of people are at home trying to manage chronic pain, trying to manage chronic conditions, and they constantly have flare-ups. And then they're, you know, they're calling yourselves to try and get help, and that's if we can address the waiting lists, I think that will help ease the burden on services like yourself, and also mean people would be a lot less frustrated in terms of not getting any help at all. And then at the heart of that is people are calling yourselves because they haven't had access to specialists who can actually give them the kind of information to manage their problems that they actually need. So this is a multi-layered problem, and it needs decisive action. It needs decisive action come from Stormont. So and it is. I mean, we're all happy and looking forward to the medical school opening up. But when you say it's going to be a decade before anybody is coming through, that's a long time for people right now that are suffering in the house and are not going to get any help anytime soon as a result of that. So, these are just points. I don't know if you've got responses to them. And from our perspective as people before profit, I mean, we think that the solution lies in expanding, the health service, public health service. There is more and more privatization, it seems to me, in the health service. And that is a worrying thing because it undermines the principle of a free health service. And obviously the pressures that you're describing and the frustrations that people have lead people who can afford it to find ways of paying to get out of that cycle of chronic pain. So thank you for being here today in your presentation.
Deborah and Lee, if I could take a few more, there's a few more councillors here, and if I could invite and welcome to the committee Councillor Seymour Barr, Lillian, please.
Thank you very much, Chair, and thank you for giving me a time to speak. Thank you, Deborah, for a fantastic presentation. My question is very straightforward, and it is about registration of new communities that come to the city with the GP services. I have experience of meeting a lot of them who experience a lot of challenges in accessing GP services in the city. And I just wanted to understand during this pandemic if there is a clear system in place for newcomer communities to register for GP services. And the next question is about interpreters services for GPs, which seems to be an issue in the city. And I wonder if this is an issue you have experienced or have come across, and if there is any plans that has been put in place to ensure that you access interpretation services for newcomer communities or that experience language difficulties.
If I could take two more, Deborah, please. It's Alderman Devaney Morris.
Thank you, Chair, for allowing me in, and can I take this opportunity first of all to wish you well in the year ahead as Chair of the committee, and I look forward to working with you as Vice Chair in the committee. And can I just say a warm welcome to Deborah and a great in-depth presentation there. When you're coming in near last, Deborah, nearly all the questions have been asked, but I'm very aware of the situation in and around indemnity. And it is good to see some of those issues in around that, because in around the Strabane area, when we met with doctors up there and other services, it was one of the big issues that we couldn't create jobs in Strabane because of indemnity, because it was an issue. And the second thing I would like to commend you on is in the recruitment drive again. I see you're bringing in some more staff, paramedics and stuff like that there, and advanced nurse practitioners. Good to see them. The out of hours issue is a big worry, Deborah, as you know from the previous speakers, that and I know we talk about out of hours, but as some of the rest of them have spoken, we have issues in around our local GPs at the minute, where people can't have face-to-face contact or appointments to, and some people do find it difficult talking on the phone to a receptionist or even going online. They prefer, and some of them like to get in to speak to the doctor. And we all know the pressures the service has been under even before COVID, and that since COVID, all of the pressure has been exacerbated across the whole system. But look, I do take on board the medical school, excellent news, but I also take on board the fruits of that medical school will be a decade away before we see doctors or nurses or whatever may be coming through that medical school. But I'll finish here, Deborah. Thank you very much for the presentation.
And Deborah, if I could just say to you, two of the councillors who were having connection difficulties are back with us, so if we could take them too, and then come back to yourself and Dr. Casey, if I could. And if I could start with Alderman Husty, Derek.
Thank you, Chair, and best wishes in the year ahead for yourself and the Chair.
Thank you.
Deborah, thank you for your presentation. During my period of isolation with non-connection there, the queries may have been answered, and I apologise if they have been. But as I say, I was able to take on board all of your presentation, and thank you for that. Can I endorse fully, it was Councillor Duffy who first brought the point of face-to-face engagement, and it's not just older people. People in general want to see their doctor or see a doctor, and I suppose that leads me through then to the first one with regard to the out-of-hours service. When engaging, have there been, or is there any evidence of difficulty of connectivity with the medical practitioner being able to access patient notes, which are obviously held? Well, I'm not sure of the system, but I mean, those would be relevant to the patient's own doctor as such. And I suppose my second point, and this would tie in with Councillor Edwards at the very beginning when he was referring to the difficulties and the concern with regard to the service at Strabane. I'm in the Derry Valley, and we have an excellent facility at our local surgery, which has been upgraded only recently. And I'm aware, and I've experienced it myself, of going to out of services and going to Strabane and finding my own doctor actually sitting there at that facility in Strabane. And people do ask the question, well, if it's not an hour service, and it's a Castlereagh doctor, why can't they be in their own surgery? Why should we have to go to Strabane all the time? And there are others actually who say, well, look, if I'm driving to Strabane, to places with that, I might as well drive on to A&E. So when you talk about relocation of bases, could you reiterate that point about the relocation of bases and perhaps expand upon it? And when you talk about relocation, could that mean less bases, or could it mean more bases, or is the determination just to retain what you have? Thank you very much, Deborah. Thank you, Chair.
Thank you, Derek. And for now, if I could ask Councillor Boyle, Michaela.
Yeah, thank you, Chair. Can you hear me okay?
Yes, yes.
Good. Listen, my apologies. I was having some problems with the internet. So I'm on the mobile phone here, so you'll forgive me for not sending my video. Listen, Mayor, I want to add my best wishes to everybody in terms of your year as chair of the committee. So I wish you well on that. And to thank Deborah for her presentation today. I missed I didn't miss all of the presentation. I got most of it, but as I say, I've missed some of the questions. So apologies if my question has actually been asked. And I suppose in some sense it's really more comments that I would be making. But obviously a lot has been said, I'm sure, in terms of out of hours and GPs. And as I say, we all have our anecdotal stories to tell. But for me, I suppose I understand that things are being done differently now in terms of access to your GP, and I suppose it's not always, in some cases I can understand where there is a generation of people who still want to access their GP, but I know that there's a lot of other clinicians out there in terms of our professionals within the health sector that can make clinical assessments rather than a GP. And I think, that's, I suppose, the way we're moving towards, and I appreciate that. But you know, I suppose for the here and now, people do want to get access to their GP whenever they have called them. And because we don't have that really set up yet, those health hubs in our areas where we can actually see other medical professionals for whatever ailments it is or issues, you know. So this is why I suppose people still want to see their GP, because, you know, we're moving towards a different way of doing things, but we're not actually set up and doing that yet. So I suppose therein lies the problem. You know, getting a triage assessment done. It's not always, as you say, Deborah, the GP, it's the nurse or the pharmacist or some other professional in that sector, whatever the medical reason is. But I suppose just in terms of, I know that there has been a lot of number of, down through the years, different incentives for GPs to work out of hours, and for different reasons, the indemnity and other reasons. They haven't been able to bring about change in that regard. But I know at one time too, there was issues to do with GPs and doctors in other jurisdictions on the island of Ireland and coming, you know, to work across, and the, you know, the equivalency and that type of stuff. So there was issues there also. But I don't really have a question as such, Chair, but just to say on behalf of the people in Strabane who've contacted me throughout COVID trying to get access to their GP for whatever reason, it has been difficult for them. I understand the pressures that most of our GPs have been under, you know, but when people on the ground are telling you the reality of the thing is, I'm not seeing a GP, and then, you know, you're being told in the public domain that, you know, that doctors are seeing patients, and, you know, it's very difficult to square that circle. So, you know, hopefully things will change as we move out of COVID and things are being more relaxed. But at the minute, and I know this, Deborah, you can't answer this because you don't have that remit, but for me, Chair, at the minute, what I'm hearing is a lot of issues around ambulatory services and people trying to access an ambulance for non-emergency red flag cancer or pediatric or renal issues. Obviously at the minute that's the case, but you know, as people are looking to access an ambulance for non-emergency, you know, for day cases, and that seems to be a big problem, as well as not getting access to the GP. But I know, Deborah, I appreciate you can't answer that here today. Thank you, Chair.
Thank you, Councillor Paul Michaela. Deborah, if I could hand it back to yourself and Dr. Casey, please.
Yeah, sorry, just to pick up on the previous group there, Councillor Doyle is obviously mentioned there about the costs and the figures for sessions and things like that. I think I've picked your point there in terms of obviously the payment for the session. Obviously, in terms of the hours, we would pay and would sort of adjust our payment plan for hours depending upon the day and the time of the week. So what you might get for a Thursday evening would be different to what you would get if you were to work a Saturday night or a Sunday night and things like that. And that would be the same as the arrangement as well we would have with our support staff, just to recognise the unsocial element of the work, obviously recognising that. But the majority, or about 50% of our budget or more each year on an annual basis, is spent on the cost for delivering the service for those costs. So it is a significant sort of outgoing for us in regards to that. And then just to pick up on your point about mental health, prior to COVID, and then obviously during COVID, and that's been well documented as well, we are seeing patients coming to us with what we might say was low-level anxiety, just because of isolation and the difficulties that's caused them. But we do have patients coming to us with significant mental health problems, and in those occasions, a GP may be able to assess a patient, but the best person to deal with them is probably one of the mental health nurses. So we do liaise with the mental health service, whether it's arrangement for patients to be admitted to Grantia Park are down there to services in Oma and Enniskillen and things like that. But we do work closely on a daily basis with our colleagues in the mental health teams for that, and within the local community as well, referring on to colleagues and specialists in other parts of the area for different mental health services. So prior to COVID, as I say, and then increasingly since COVID sort of been a burden to us all, but mental health, we are seeing an increasing number of patients coming to us for that since COVID's sort of come upon us. Just to pick up there in terms of Alderman Hussey's points, face-to-face appointments, we still continue to offer them, and we understand that the technology solution isn't suitable for everyone, even for young people. Sometimes you actually feel you need to be seen, and even in cases when we do a video call with patients, the GP might decide, no, I really do need you to come in, and they might actually need to do a physical assessment of them, in terms of maybe it might be palpating their stomach or feeling wounds and lumps and things like that and what have you. But sometimes they actually physically have to put hands on patients. So whilst they might want the technology solution, they do need to be seen. And we are seeing patients coming in, and we do get patients who will contact us and say, look, I've been to see my doctor or I've had a telephone triage, but they're not satisfied because they haven't had that face-to-face contact. So they're coming to us in that regard as well. But we understand the situation of colleagues in the practices, and we're faced with the same as well. And likewise, I'm sure we've had patients contact us and they might have had a telephone triage or video triage, and maybe the next day or the day after, they're likely to actually contact their own GP and go back to them and say that they're not happy with that and they want to be seen. But we do know it's not ideal for everyone. And that's one of our projects in terms of innovation and quality and working with those patients, as I say, in care homes and things like that. One of the things we do as well is we would do home visits for elderly and vulnerable and infirm patients. So we still do the home visits to the patients, so they still will have that face-to-face. We wouldn't expect them all to come into the base to be seen. So we do still have quite a number of face-to-face appointments on a daily basis. In terms of the option there for a walk-in service in addition to the ED and things like that, it may be an option, but obviously that would be something that would have to work up with the trust and the board in terms of providing an additional service, and what would that look like, where would it be located, and the types of patients that could be seen there, and would it be for physical ailments, for mental health, or would it be for medical conditions? So obviously that would be a massive piece of work in terms of delivering that, and obviously with the trust as well and the board, they'd be trying to ensure there's parity across the area as well in terms of the northern and southern sectors, so areas across all the areas that we work in, the localities. Yeah, so with COVID that might not be an option, but I dare say it might be something, as Dr. Casey says, maybe down the line in terms of that. Obviously, in terms of Councillor Harkin about the pressure on services and the public's frustration about access and the waiting lists and chronic condition management, we do see the effect of that in terms of patients coming to us looking for medication to deal with pain. We have patients coming to us who have been on waiting lists for some time, and in some cases someone will tell us that they come to us in the hope that it might expedite things for them in some way, but unfortunately the service doesn't work like that. We can only deal with any urgent medical needs they may have at that time. But we do understand the frustration, and we do take the point as well, and it seems logical that if the waiting lists are reduced, it would reduce the frustration for patients and the need for them to actually go back to their own GP with ongoing issues. If the issues dealt with at that time, it might reduce the long-term impact for them in that regard. And the point about 10 years, yeah, you think if there's a medical school here, it won't be long until we see them. But by the time you get them through, the GPs and the students through all their studies, obviously we'll get the benefit of them when they are studying and they are working in the hospitals and they are doing their training within the practices and things like that. But in terms of being fully qualified, it's unfortunate, but we are looking at maybe a decade before we see the benefit of that. and the completion of all their studies. The councillor bar, in terms of the communities coming to the city, obviously as an out of hours service, we deal not just with the local population, but we also deal with the visiting population. So we've always dealt with anyone coming to holiday in the local area, people coming to study in the local area, or people just working in the local area who aren't registered with the GP. So we deal with those patients on a daily basis. And what the arrangement we have and the restrictions we work under is we will give them perhaps medication for a short number of days, maybe 2 or 3 days, until they can contact their own GP again or whatever it might be. But we do care for those patients. We wouldn't turn anyone away just because they're not simply registered with the GP in the local area. So we do deal with any patient and provide care to them when they contact the service. And in terms of interpretation services, we do have access. We have a system set up not just for individuals with foreign languages or from foreign countries, but we also have services for patients who are deaf and hard of hearing, so that we have those services as well when they contact our call centre. So we do have ways there in terms of supporting minority groups as well. Councillor Devaney, obviously we're quite positive as well about the news of the Crown indemnity, and we will continue on with the recruitment just because we know we have to. There's nothing else for it, and we know if we look at the local workforce and the number of GPs retiring in the next few years, we're going to have more GPs retiring, and obviously that will put additional pressure on the local GP population, but also on ourselves as well. So we have to continue on with our efforts to meet the needs of the patients that come to us. Sorry, Councillor Hussey there, it's just about the face-to-face. I think I've said there already about the face-to-face. There are some patients that want to see a GP, and that's fine. That's why our GPs are here, and we continue to offer face-to-face. In terms of your question there about issues with connectivity, the clinicians, when they're dealing with patients, we have access to GP notes. It's called the ECR, which is an electronic care record. So if you were to contact our service this evening, our clinicians can actually look at your latest clinical notes and any recent tests you might have, any historical discharge notes from if you were discharged from hospital, lab results. They can also see medications and when you last received your medications and things like that. So we do have access to your medical notes. So they might not be familiar with you and you're seeing a different GP if you go to a base, but they would have access to your medical notes. In terms there as well, you were saying about sometimes if you go to a base, you might see your own GP. And your question about the relocation of bases. When I said relocation of bases, my reference there was the fact that we're going back to where we were. Obviously, we've been relocated temporarily from the Anthony Galvin site over to Great James's Street Health Centre. And in the SWA area down there, Enniskillen, we've been relocated from the SWA department where we were out to Lakeside Health Centre, which is further into the town in Enniskillen. In the next few weeks, we're planning to relocate back to and return to where we were originally working from. The benefit of that is we've more space. There's more clinic rooms for us to work from. We can get more nurses to triage in those bases and things like that as well. So we have that facility there. And the benefit of that as well is we're closer to things like the pharmacy. One element of our service is the provision and the support for the Marie Curie palliative care service. So at least then we'll be closer to the hospital, quicker access to palliative medications to patients whenever they might be needed during the out of hours period and things like that. So that will avoid any delays for those patients too. So when I'm saying there about relocation, that's about moving back to where we are. That's not about moving any of the other existing services from Strabane Health Centre or from Limavady Health Centre or from the Oma Hospital and Primary Care Centre there. And there's no plans for less sites or more sites. The plan is just to retain the existing stock that we have at the moment and the existing bases that we have at the minute. Sorry, and just there in terms of Councillor Boyle's points about out of hours and doing things differently. Well, I think we were planning to do that prior to COVID. That's moved us on, as I say, in terms of our options for the use of technology for triaging patients. For a period there, significant long period, we were actually faxing prescriptions to local pharmacies for patients, but we did find that that didn't actually work. It was a labour intensive process in terms of checking which pharmacy it was to go to, contacting the pharmacy to let them know we were faxing it, faxing to the pharmacy, and then contacting them again to make sure that they had it. And then after all that work, we found that a significant number of them were never actually being collected from the pharmacy. The pharmacy was actually returning the prescriptions to us uncollected, so that they could be destroyed and removed from our records and things like that. So obviously we're still working, that's a piece of work we're doing with the Health and Social Care Board as well. We're still working with them about how we can actually get an electronic solution like they do across the water there, that they can benefit from there. Sorry, I'm trying to think here. You did make a point there about the trust issues and about the red flags in ambulatory care and paediatric care. But as you did note, that's not really within our remit here with the GP out of hours service. That would be a trust issue in terms of the access to those services. We know in terms of our service, we'll never be able to provide the type of service at the time and the location in the way that every single patient wants to do, but we do our best every day to try to ensure that we can meet the needs of as many of the patients as we can. We obviously cover an area with over 300,000 of a population. It's not just the Derry Strabane area, but our population's over 300,000. Plus, we also provide for some patients just along the border, along the Cot area as well. So there's patients in there too, but we know even when patients contact us and we offer them appointments, they don't want it at this time. They want in a certain place at a certain time and things like that. So we try to accommodate them as best we can. But we know we'll never meet everybody's requirements every single time.
Deborah and Dr. Casey, if I could, on behalf of the committee, thank yourselves for not just a very informative presentation, but a range of answers, which obviously shows just the breadth of work and effort that yourselves bring. And while obviously members raised relevant issues, I think everybody was very appreciative of the work and the care that you provide on a daily and nightly basis. So on behalf of the committee, if I could just thank yourself and Dr. Casey. Thank you.
Thank you very much, Chair. And we're always happy if anyone has any questions or any specifics, and we appreciate constituents contacting you with queries and concerns and things like that. I'm quite happy if Lorraine wants to share my contact details with the group. If anyone ever needs to contact me directly, I'm happy to do that and have a conversation or an email, whatever that might be.
Very appreciative of that as well, Deborah.
Yeah.
I'm sure. Thank you. Thank you very much.
Thank you very much, folks, and thank you very much for a lovely welcome. Thank you.
Thank you,
Okay,
folks.
thank you. Take care.
Bye.
Members, if I could move on in terms of chairperson's business, and there's just one item of chairperson's business, which is brought by Councillor Carr. I'm going to ask Councillor Carr in a minute to obviously address the issue that he's putting before the committee. I just wanted to say in terms of, and thanks to everybody for their kind words, and as I say myself and the Vice Chair, Alderman Devaney Morris, will endeavour to facilitate the meetings as best we can, so the work of the committee and the important issues can be addressed. And obviously I've already welcomed Councillor Simoy Bar Lillian to the committee, and Lillian replaces Councillor Martin Riley. And then also yesterday, I think it was Alderman Keith Kerrigan replaces Alderman McCready. And then I think there's a few other people who've come back to the committee, so everybody is welcome. And just before bringing Sean in, folks, if I just maybe say to people, if we pencil in a break at 6 o'clock, and if we're still going at 8 o'clock, pencil in another break at 8 o'clock, both times for 15 minutes, if people are okay with that. And for now, if I can ask Councillor Kerr, Sean, please.
Thanks, Chair, and can I add my congratulations and wish you good luck for the rest of the year as well.
Yeah.
And thanks again for allowing me to come on Chairman's business. Chair, this actually came up just the other day, so there wasn't time to have a motion to council, and I think it's very important that we discuss this, and I appreciate you allowing me to come on and do this now. Myself and Councillor Donnelly have met a number of families over the last couple of days. Children is going to post-primary education in September. These children have additional needs and require special education settings. The Education Authority has informed the families that they will not be facilitating this and advised these families to send their children to mainstream schooling. This has caused considerable anxiety, stress to both children and parents and guardians. Chair, this is unacceptable and needs to be, and the needs of these vulnerable children need to be met by those responsible. We are aware that there's other children out there in the same situation, Chair, and I would encourage any family that's in this situation to seek help and assistance and oppose this denial of a basic human right. And Chair, if you don't mind, if I make a proposal, I'll put it up in the chat. Chair, do you want me to give a wee minute to let people read it?
Chair, you're on mute there.
Is that okay? Can you hear me now?
Yeah.
Sorry, Sean. There's a couple of other councillors have indicated if I'll bring them in as you're putting that in the chat box, then we can come to consider it. Councillor Donnelly, Gary.
Chair, and just to wish you and add more on your appointment as chair, and thanks for letting me in and not a member of this committee. But as Councillor Kerr has said there, myself and Sean have met a number of families over the last 2 days, Chair, and basically these families are going through a terrible time. They have children with additional needs, and particularly there's children who are ASD, and for them children and the parents, Chair, any parent who you know, autism at the minute is very, very prevalent, and it can be a difficult and complex situation. And within that situation, Chair, anxiety can play a large part. These children need routine, they need stability. And by any standard, post-primary, the move for a child to go to post-primary is a big step on their educational journey. And a child with additional needs, including ASD, this can be magnified many, many times. And this is a difficult journey too for parents. The parents that we met, Chair, have a statement of needs. Educational psychologists have recommended in these cases that these children attend a specialist educational setting, and this has been ignored, Chair, by the Education Authority, and these parents have effectively been told that they place their children in a mainstream school. And you know, the anxiety and the worry on these parents is you know, it's very, very real. In fact, some of these parents have told me, Chair, that they will not send their children to school unless they're treated properly and they have the adequate educational facilities. So I think it's important and appreciate you allowing Councillor Kerr in here today and myself a chance to speak. I think it's very, very important that we as elected representatives do everything that we can to assist these parents and ensure that their children are given the basic human right of a proper education that meets their children's needs. Thank you, Chair.
Thank you, Gary. Of a number of other speakers, folks, and obviously we can see it has been shared there by Nuala. We can see the proposal. The next speaker, Councillor Tierney, Brian.
Thanks very much, Chair, for allowing me in. And if I could just join my others and wish you all the best in your year as Chair of this committee. Chair, like Councillor Donnelly and Councillor Kerr, I've been contacted by a number of parents who also are going through the same scenario as what the two previous speakers have described. And today, I've written to the department. They expressed my concern at not only the fact that these children these parents are being told that there's an option there to send their children to mainstream school. None of these parents that I have spoken to here want to send their child to the ASD unit, but they understand that that's the best place where their children should be educated. If they wanted them to go to mainstream school, they wouldn't have put down their first choice as the ASD unit in any of these areas, in any of these schools. But the very fact that their needs now seem to be being ignored by the department is something that I think is very, very alarming. I also think that the department need to understand that a place for any child needs to be the appropriate place. I've had some people that have applied to go to the ASD unit on a school in one part of the city and have been told that school is full to capacity within the ASD unit. So we're going to send you to another school at the complete opposite end of the city for any child at that particular age, but particularly for a child with autism or with ASD. That's a major, major change. It's the preparation that these families go through to prepare their children to move from a primary school where they're comfortable and where they know their surroundings and they know everyone else. The preparation starts a lot long before the offers are out, and then for that to be swept right from under them to be offered a completely different school should not be happening. I would encourage and have encouraged the department to relook at the attitude and how they're treating these families and how they're allocating these places. These children need to be educated. They need to be educated in an appropriate setting where they're used to and where they're comfortable attending, and they need to be looked after and catered for. So, in terms of the proposal from Councillor Kerr, I don't know whether Councillor Donnelly has seconded it or not, but if he hasn't, I'm quite happy to do it. And I would urge the department to relook at this and they meet and discuss this, talk this through with the families, because what I have seen, Chair, as the department were engaging with the families and then they received a letter from me, and all of that engagement has now, over this last 24 hours, has just stopped. And I don't know whether that's a coincidence or what, but it's something that's alarming. September is coming fast and furious, and these families need the peace of mind to know that their children's going to be educated in an appropriate setting that meets their needs. So on behalf of the SDLP, we support this proposal. And as I say, if it hasn't already been seconded, Chair, I'm happy to do it. Thank you.
Thanking you, Brian, and just a couple of things. I should say that I would declare a non-pecuniary interest in terms of the subject matter, and also just if I heard Councillor Donnelly, if I heard Gary right, he's not on the committee, so we take it, Brian, that yourself would second it. Then, as you says, if I could ask Councillor Duffy, Sandra.
Thank you, Chair. Yeah, absolutely. A really important issue to bring forward. As a party, we have also been contacted by parents in this situation, and Chair Mullen MLA has written to the Minister accordingly. Absolutely can feel the stress from these parents. It's stressful enough and anxious enough for a parent to watch a child move from primary school to secondary school, never mind a child with additional needs. So absolutely no issue in supporting this proposal. Vulnerable children need to have their needs met and met appropriately. There needs to be a special educational setting where they receive the educational needs that they have and also receive the support that they will need in addition to their education as well. So a really important issue to bring forward, Councillor Carr, and as a party, as Sinn Féin, we have absolutely no issue in supporting this either. So happy with that.
Thank you, Sandra. Alderman Devaney Morris.
Chair, for allowing me in, and I have to say, good to see Sean bringing this to the table. It's a very, very important proposal, and I do believe that the welfare of these vulnerable children, securing an appropriate post-primary school placement where their needs will be met, is vitally, vitally important. And as I heard one of the previous speakers saying that some children have been asked to move to the other side of the city, and it takes them out of their own environment. And Chair, our party of the DUP has no problem in supporting the proposal to write to the Minister of Education on this issue. Thanks, Chair.
Thank you, Morris. Councillor Harkin, Sean.
Thanks, Chair, for letting me in, and thank you to Councillor Carr for bringing forward this motion. Obviously, I would concur with a lot of others, councillors and aldermen, in terms of why this is important. It just seems to me that the Education Authority and the Minister for Education over the last year and a half has been very, very out of touch, and has left a lot of people very, very frustrated. Students, parents, teachers, education based workers, and this is really just a continuation of it. It's a kind of just, we are going to tell you what to do kind of attitude, rather than the listening to the concerns that parents have and the needs parents have for their children. And I think it should be, they should be listening, and then they should be responding, rather than throwing out these directives. And this is Stormont being very, very out of touch with the needs of people. So look, you judge a society based on how it treats children. And there's too many examples of how children, especially vulnerable children with special educational needs, are not being treated properly. So we do need to call those with responsibility here to account, both the EA and the Minister. And I think this is very important, and hopefully this will get support right across the council today. Thank you.
Thank you, Sean. Alderman Guy Darren.
Thank you, Chair, for letting me in. Chair, all the best for the coming year as chairperson, and same to the vice chair as well. On behalf of the Ulster Unionist Party, we fully support Councillor Carr's proposal. We see placement problems missing or rising each year, especially in post-primary education. Most cases are sorted before the term commences, but when pupils are statemented as SEND students, then there needs to be an urgency shown from the Education Authority and the Education Minister to accommodate these children in an appropriate environment that will give them the rights all children should have to a proper education and incorporating all the child's needs. Thank you, Chair.
Thank you, Darren. Councillor Ferguson, Rachel.
Thank you, Chair, and thank you to Councillor Carr for bringing this forward. I don't think anybody can summarise it better than Councillor Donnelly did. This is a really stressful and anxious time for many, many students, and even more so for students with special educational needs. Sometimes it takes the entire summer for parents and families to get the children used to the idea of moving to a new school and having their needs met. So when they're going to school, they don't even know what school they're going to or whether their needs are met. That can cause so much anxiety. I think I fully support this proposal, and I think it's a great way to highlight the issue, especially with the current I think it's been overshadowed with politics at the moment, and it's unfortunate, but I hope the Minister does take this as a priority and make sure that we find some appropriate spaces for every child. Thank you.
Thank you. Rachel, and certainly unless I've heard anything different, which I don't think I have, there's widespread support across the chamber. Sean, your proposer, back to yourself. Councillor Carr.
I think it was Councillor Doyle there looking to get on the front.
Sorry, I never seen that. Sorry, I'm at Councillor Doyle.
Thank you, Sharon, and thank you, Sean, for bringing this forward. Sean will know from many years when we used to work together that there's been an agenda at work in terms of special education and provision right back for the in the last 10-15 years. We saw, for example, the closure of the Woodland Special the speech and language unit. Then we saw the start of special statements coming out where effectively people were told, yes, we recognize based on a child psychologist report that your child has additional needs, but we're not actually going to allocate any resources to that. That's been happening over the last number of years as well. And this is just the latest attack. And what it comes down to is, and I think in fairness, Sean mentioned this as well, is it comes down to priority. The Education Authority are quite willing to allow people to row their own boat when it comes to this, and that's entirely unacceptable. I'm more than happy to lend my support to the motion as well. Thank you.
Thanking you, Emmett. Back to yourself, Sean. Councillor Carr.
Thanks, Chair. Look, and just could I thank all members for their comments as a subject that would be dear to most people. I believe that the Education Authority here is trying to divide and conquer, because how this come about this week, Chair, was they got a phone call on Monday, surprised phone call, and to be told you have to go to the mainstream school and we'll phone you back on Thursday to make up your mind. To me, that was dividing all them families and putting them under pressure to make a decision, a quick decision. So I'd just like to thank everybody for their support. And Chair, thank you for allowing me on your chairman's business.
Thanking you, Sean. And as I say, folks, unless don't think we've heard anything different other than widespread support for Sean's motion and for the stance on the issue. Okay. Thanking you, Sean. Members, in terms of item 6, which is the open minutes of Health and Community held on Thursday, the 13th of May, in terms of accuracy, pages 9 to 20, pages 21 to 42. If I could have a proposer and seconder, please.
So proposed, Chair Morris.
Seconded, Darren.
Thank you, Darren. Thank you. In terms of the items, folks, in terms of matters arising, pages 9 to 20 and pages 21 to 42. Okay, folks, moving on to item 7, which is an issue, again, raised by many people. If I could ask Seamus.
Sorry, Chair, there's a few hands up there.
Sorry, folks, that chat box isn't working for myself. If people could let me know who was logging in.
Councillor McHugh.
Councillor McHugh. Councillor Rory.
Yeah, thank you, Chair, and best of luck.
Harden too.
Best of luck to you and your Vice Chair for the incoming year. Thanks for letting me in. I'm no longer a member of this committee. It was just under accuracy there regarding Strabane playing fields. It makes reference to the Bay Road when actually it should say Drumna Bay Road.
Okay, Rory, forget that. Corrected. And I heard Sean, Councillor Harkin, but if I could go before Sean, I'll come back to yourself, Sean, and Councillor Edwards, Stephen.
Chair, thanks for letting me in. Just on HC 123, I'm just wondering if officers have had any further discussions with IFA just to see if that event at soccer school can be held. And Melvin, just for an update on that, and also HC 129, Chair, I'm wondering if there's any update on the Glebe playing fields, because it is a centre of antisocial behaviour across the wider Glebe area. It's an issue I'm getting contacted with daily on, and I know it's a PCSP and a PSNI issue, but I do think council has a role too. They're using the dugouts up there. I'm not too sure if they're locked or whatever. There's sort of cages across them. So I was just wondering if officers could give me an update on that. Thank you, Chair.
Thank you, sir. Council officers.
Chair, you want me to take those questions?
Please, please.
Okay, firstly, in terms of the IFA soccer camps, the IFA had already committed to the alternative venue and had moved to publicise their programme very, very shortly after our last meeting. And the programme starts, sort of early or sort of mid-June and extends right through the summer at a variety of locations. So that PR wasn't trained. However, our team in sports development have had discussions with a range of governing bodies, and one of the subsequent papers this evening, you'll see the outworkings of our own summer camp programme and those of other governing bodies where that information has been available. In terms of Glebe pitches, we don't have any specific update beyond that our community safety team have this on their agenda, but I'm happy to do a recheck on that, Councillor, and bring you back an update.
Thank you, Karen. Councillor Harkin, Sean.
Thanks, Chair. Yeah, just on HC 126/21, I mean, the reopening of outdoor sports has been very, very welcome. And I've met with some members of the Rosemount Bowling Club, and they're delighted to be back out bowling again, hosting charity events. They have been in contact with council officers regarding some issues with access at their club. Some of that has been resolved, and that's really appreciated in terms of seating and water access. But they mentioned a few other things, and they just wanted to get them on record for officers. One is that there used to be a summer staff member there that would open the place, keep it functioning, and I think that exists in all our facilities, all our bowling clubs. So they're just asking if that is something that can be looked at again. It would help immensely with the running of the place. Two is, I mean, this is something maybe it merits more discussion. But I'm sure people seen what happened to the footballer Ericsson last week or this week. It was quite frightening in terms of his cardiac arrest, and the defibrillator was crucial. And they were wondering if it would be possible to get a defibrillator there. Now, there's probably many places that when we're reviewing this, might be an appropriate place, but that's just one thing I wanted to raise. And then obviously we've had a series of discussions about the future of the clubhouse there, and about a proper clubhouse being built, and they're just eager to get an update on that as well. So thank you, Chair, for letting me raise that.
Thanking you, Councillor Harkin, and on the same issue, Councillor Tierney, and then obviously I'll ask council officers to address. Brian.
Chair, thank you. Can you hear me all right there, Chair?
Yes, can, Brian.
Thank you, Chair. I know I put on the chat box, it's the same issue. It's technically the same minute, not the same issue. If you don't mind, it's the reopening of outdoor sport. Last week, we seen, thankfully, we seen spectators return to the Brandywell. But since then, I think it was 155 at that particular time that was admitted, and there was almost competition for seats at the Brandywell. There's that many people looking to get back to it. Chair, can we ask officers to give us an update, and I suppose in many ways a rationale as to why it was only 155 allowed in, when, as I understand it, currently the executive advice for outdoor sport is 500. So, and in my opinion, and maybe I'm wrong, but the Brandywell is more than capable of holding 500 people, socially distanced. But as I understand it, out of that 155, that also included the press people who were there, the photographers, and the management, the stadium management, and stewarding and all of that. So in terms of supporters actually going to the game, it was probably less, significantly less than 155. So, Chair, I would like to see if officers could give us a rationale as to why it's 155 and not the following the advice and the guidance that's laid down by the Northern Ireland Executive, please. Thank you.
Okay, Brian. Councillor, Alderman Hussey, I know you're saying it's the same point as Brian, but do you still want to speak to it?
Yes, just to
Eric,
support.
okay.
Thank you, Chair. Just to support Councillor Turney there. I mean, I've been contacted on this as well, and you know, it is strange to note that Irish League fixtures, for example, I understand that some of them may have been assembly test cases or whatever it may be, but considerably more spectators being allowed into venues which are actually have a smaller capacity. The Ryan McBride Stadium at Brandywell, and I have engaged with Barry on this, but I feel there is a need that the needs not just of those playing, but those who wish to enjoy watching sport be taken into consideration. And if it was the case that officers could maybe even approach the executive, and if it's still there, and say to the relevant ministers, well, you know, can we have a test case at the Ryan McBride Stadium at the Brandywell? Thank you, Chair.
Thank you, Derek. And if I could just take on this item as well, Councillor Burke, Tina.
Thanks, Chair. And it's just in relation to the request from Councillor Harkin. I myself had intended on raising this later on in the meeting, but I suppose first off, just to acknowledge the event at the weekend in the Euros, and obviously to send well wishes to Christian Eriksen in terms of the best of his recovery. I know the scenes were traumatic for a lot of people, but I suppose one good thing that has come out of the weekend and what happened was that it's elevated awareness in cardiac issues, and we now know that the fact that the defibrillator alongside the quick actions of his team and the staff there was what saved his life. As a council, our sporting facilities thankfully do have defibs on site, and it's something we should be proud of. And I know Councillor Harkin was asking there about a defib for a specific site, but what I was going to ask is, could council work with other sporting facilities across the city and district who mightn't have them to see if there's any way we can ensure that all do, or how we can work towards that? Thanks.
Thanking you. I see Rory McHugh has put in, Councillor Rory McHugh has put in the clarity in terms of the accuracy point that he was raising. I see Councillor Harkin looking in regards to the Brandywell. Sean.
Thanks, Chair. Yeah, and thanks, Councillor Tierney, for raising the issue of the numbers. I mean, obviously, people are desperate to get back into Brandywell, and are frustrated at the numbers getting in right now. And I was just wondering, I mean, I get contacted by quite a few people about the security barriers that have been put up there on the wall at the Brandywell, where I know some supporters had kind of gathered in their eagerness to watch the games. And obviously this is is that something that is going to remain, or is this a temporary thing? Because it would be, it'd be great to be able to get that down as soon as possible, as people start being able to get back into the matches.
Thanking you, Sean. Folks, I'm just conscious that there's maybe a couple of issues there, and I know if maybe ask council officers to address the initial issues raised by Councillor Harkin in regards to the Rosemount Bowling Club, and then maybe a way then to address the issues mentioned in regards to the Brandywell, if that's okay.
Thanks, Chair. I'll answer the questions in relation to the bowling club first, Councillor Harkin, if you want to come back, and any of the responses. One of your questions, Sean, was in relation to, we used to have casual attendance. We have casual seasonal attendance that we employ at Liston Galvin, because it's not attached to a main leisure site, so we have to do that from a a management and a health and safety perspective. When we built the new contact sports centre, we increased the staff and complement at Brook Park and factored that in that the staff on shifts and in rota would be available to service the bowling green. So that we don't have any plans to go back to the old model of casual attendance over the summer months. So there's a budget issue first and foremost, and secondly, the staff and complement. We're content on shifts and rotas that we can cater for the bowling club's needs. There was a meeting yesterday, one of your other questions, Sean, in relation to the club getting access back into the building. We're getting them in around making tea and stuff like that, but we're actually going to open the building up to them, open to them next Monday again, based on risk assessments, and allow them in. Access obviously for toilets is already taking place, but to make tea and that, as long as they follow the social distancing measures and apply the risk assessment, we'll have no difficulty as of next week allowing them back in. I can't recall if was there a third question, Sean, that you had on Brook Park?
Sorry, yeah, it was just in relation to it might be a place to consider for a defibrillator.
Yeah, we have had discussions actually in recent years with the club, and that we do have a defibrillator at the site, at the main leisure centre site. So it is something. Look, Councillor Burke has asked the question of us. We worked in partnership with Sport Northern Ireland 2 years ago, and there was an open application process for all clubs, and the council availed of that as well throughout the district who wished to have a defibrillator. So I've already been in discussions with Sport NI today actually on it. I was at a phone conversation in passing with them about the Christian Eriksen incident, and we're looking at that. They're going to go up the line within Sport NI and see is there any opportunity for any further funding opportunities. But as part of that review, and obviously we do this on an ongoing basis anyway, we will be reviewing all our defibrillators right across all our sites and following any risk assessments that may need updated. So that is something we'll be looking at right across all our own facilities, but also seeing what we can do to assist other clubs and community groups going forward, and can we generate more funding to bring those facilities back in and get more defibrillators into the region.
And in terms of the Brandywell folks who cover the issues around the Brandywell.
Yeah, Chair. In terms of the Brandywell, and last Friday evening's game was applying the Sports Ground Safety Authority's guidance. So that particular group is chaired by Philip Kingston, and the council and club and other statutory partners sitting at. So that was a test event, and the Sports Ground Safety guidance was applied to the club's ticketing policy and their match risk assessment and their stewarding plans for last week, and that determination of around 165 was decided upon the previous Monday. Now that didn't include household bubbles. Their ticketing plans didn't include household bubbles, so that's something we're looking at for the next home game. So we're awaiting the latest risk assessments and club documentation around that. So I would be hopeful that the next home game, the test event last week, went very well. We had our environmental health team and our leisure team down. We're very happy with how it went, how the club managed the event. So I would anticipate, based on updated documentation, that the next home game will be up towards the maximum amount permitted under the regulations.
Thanking you, Barry. And I just asked Councillor Tierney back in again, and he wants him back in on the defibrillator scenario. Brian?
Thanks very much, Chair, for allowing me back in. Just on the defib, and I know Barry was saying there that he's hoping to work with sports clubs and community groups in relation to this. But after witnessing and watching, like many people, the Christian Eriksen incident during the week, I went on the Northern Ireland Ambulance Service website, where there is a populated map of the council district to show where all defibs are, and obviously then there's guidance around how to use them and stuff like that there. But I did notice, Chairman, that there was a lot of gaps. Now, I'm not saying that there's gaps where there wasn't or there isn't defibrillators. I'm saying there's gaps where it is not registered on the map. And if Barry or whoever's doing this work around the defibs could ensure that clubs and sports clubs and community groups know that how important it is to make sure that that is published on the Northern Ireland Ambulance Service map, and making sure that they know how to do it. And if maybe we could, I don't want to suggest we carry out an audit, but a quick glance at the Northern Ireland Ambulance Service map will tell you and will very easily point out where the gaps are. And I think, Chair, we will all agree that this is far, far too important a piece of equipment to be sitting there and people not knowing it's there when it's needed and required. So we could just maybe look at that whenever we're doing that work with the sports clubs. I'm pretty sure that that will be much appreciated by everyone. Thank you, Chairman.
Thanking you, Brian. I'm sure, Barry, we can incorporate that into the work.
Yeah, through yourself, Chair, we'll be cross-referencing the list that Sport NI, and we have Karen and myself and others within council have been liaising with NIAS in recent years around this defibrillator issue. So this is something that has been ongoing and on our radar for quite some time, and we're heavily involved over recent years. So look, it's something that we'll keep on our agenda. Obviously, this has brought it to more of an attention after Saturday night's incident, but that's something, look, we'll be following up on and cross-referencing all of the relevant information we have. I think I forgot to answer the query around the Brandywell, around the barriers on the, I think, Councillor Harkin, you're referring to on the wall to stop people sitting on it. That has been the result of children congregating, sitting. There's quite a drop there. Antisocial behaviour happening and people getting into the grounds over the weekend when the facility's shut. It is there's a temporary measure. I think that's what you're particularly referring to, or maybe it's something else, but that's something that has been put in place after many issues that we've had of young kids getting into the site and actually sitting on that wall. It's quite a drop. If you were to fall down that wall, it would, the consequences, heaven forbid, what would actually happen there. So that is that. I think that's what you're referring to, Councillor Harkin.
Okay, Barry, thanking you. Folks, I can't see any other matters arising unless anybody wants to say anything before we move on to, if we can now, to item 7 and ask Seamus Donegie. Thank you, Seamus.
Thanks, Chair and members. The purpose of the report is to provide an update on dog control services, including the Responsible Dog Ownership campaign recently introduced to tackle the problem of dog fouling across the council area. The report outlines council's statutory role in providing a dog control service and highlights the information and statistical returns submitted to Derry on a quarterly basis, and they are outlined in the appendix. Members, of the Responsible Dog Ownership Initiative has been successful, and details of areas patrolled and the findings are outlined in Appendix 3. The report also outlines the dog control orders recently implemented for the council area and the cross-departmental work taking place to ensure dog owners and members of the public are aware of the requirements. It also covers the new dog or green dog walker scheme, which is currently being implemented, and further details of the scheme will be provided at a future meeting of this committee. Members, following a recent council motion, the team have also issued information to dog owners relating to dog thefts, which appear to have increased over the last 12 months. The report outlines the staff resource involved in the dog fouling campaign and the associated costs. Though subject to members' approval, it's anticipated that the pilot will finish at the end of June to enable staff to return to their substantive roles. Members, the main focus for the team over the next few months will be to continue responding to complaints and the implementation of both the Green Dog Walker scheme and the new dog control orders. And the dog control team will work with all our council departments on these areas. So members, it's recommended that you note the work undertaken by the dog control team relating to responsible dog ownership and agree that the dog control initiative continues to the end of June 2021.
Thanking you, Seamus, for the report. And asked Alderman Devaney Morris.
Thank you, Chair, for allowing me in, and I thank Seamus for bringing forward the report here. Just a question on the number of dogs licensed. I'm just wondering, Seamus, is that up or down on previous years? And look, I welcome all the work that you are doing. But as I look through the report, once again, the big issue is dogfiling and how we deal with it. I think I see here enforcement action. There's 27 altogether, different avenues, but I see 4 for dogfiling. And, you know, I have to say, Mr. Chairman, out of all the initiatives that this council has left out, dog signs, we've given out doggy bins, we're putting up doggy bins, dog signs, and people say dogs can't read, and all of the initiatives and around that, I do find that there, because of the enormous issue in around dogfiling across the whole council area, that we have only 4 enforcement action taken here in relation to dogfiling. And I think if we're honest, Mr. Chairman, if, you know, really, if that's all the number that we can get, I think we're failing for our citizens who continuously ring us as public representatives or contact us in relation to dogfiling. And I really don't know where to go with this, what more we can do as a council. But I have to say, just worrying and around only 4 for dogfiling. Thank you, Chair.
Thank you, Maurice. And Seamus, I'm going to take, there's a number of councillors down to speak, so if I can take so many and then come back to yourself, Seamus, and the next councillor is Councillor Ferguson. Rachel.
Thank you, Chair, and thank you, Seamus, for the report. And I must congratulate Seamus and the team for the focus that has gone on with the dogfighting and dog control measures. It's been a really great campaign, and I'm pleased to see that the dog theft had such a great focus on it too. Seamus, I suppose my questions would be around maybe possibly highlighting, I think I mentioned it at the full council motion, highlighting responsible dog breeders and puppy farms. We've seen an increase of dogs being bought and the prices going from a couple of £100 to, you know, £1,000, £2,000, £3,000. So I'm hearing from the charities that there's an increase of puppy farms popping up around. So whether or not we have any responsibility in promoting using responsible breeders or even our charities. And then slightly off topic, I have been made aware, and I think I've sent you an email about it, Seamus, about the possibility of an exotic pet store coming to our city and district. And I have been in contact with the all-party working group in Stormont around animal welfare, and the proposed owner has had his license revoked due to selling endangered species. I'm wondering if that does come to light, what kind of mechanisms we have in place to kind of step in and make sure that these animals are looked over. But as I say, slightly off the dogfighting topic, but any support would be appreciated there, Seamus. Thank you.
Thank you, Rachel. Councillor Tierney. Brian.
Chair, thank you. And just to support the recommendation, and I'm not sure whether it was proposed and seconded by the 2 previous speakers, but if it's not, I'm quite happy to stick my name down to it. Chair, you may know that during my time as mayor, I was in every DAA right across this council district with the dog wardens, and I can tell you it's a difficult job that them guys are doing, and fair play to them for the work that they are doing. I know Maurice Alderman Devaney talked there about only 4 penalties being issued, but you know, we have to also, whilst this is a big issue, there's no doubt about it, right across this council area, we have to also remember that there's only a small team of dog wardens who are out and about, and they can't be everywhere, and they can't. It's really about being in the right place at the exact right time to make sure that these penalty notices can be issued where they should be, because failing that, they need members of the public to come forward and be able to stand over and take it to the very end to get the notices issued. So whilst it may only be 4, it's still a difficult job for the dog wardens, and they're still out there every day doing their best to try and make sure that where they can that they do act. So just they thank Seamus for the report and to be associated with the kind comments towards the dog wardens. Thank you, Chair.
And thanks for that, Brian. And just to say from the group chat there that Councillor Ferguson, Rachel has seconded the report, the proposal. And Seamus, have a number, just a number more, and then I'll come back to yourself. Starting with Councillor Duffy. Sandra, please.
You, Paul, and not to keep the meeting, because what I wanted to ask has really been asked by Councillor Ferguson in relation to the puppy farms, and I know that that's a major issue, particularly over the course of COVID, where we have seen the sale and breeding of dogs has significantly increased. We also seen an increase in dog thefts over that period as well, which was concerning. Thank you to Seamus and to all the team in terms of the work that they have done, in particular the dog wardens, I suppose. From reading the report, some of the figures on them, I had to do a double check on them in terms of the number of patrols and stuff that have been carried out. So there is no doubt that there has been a significant amount of work done on this. We understand the issues around the dog fighting, and Councillor Tierney, when he was mayor, to hold that initiative, which was very good, and it highlighted the issue, particularly with seeing the increase in people out walking and walking their dogs. I have to say, on occasion, I have been out and have been caught without a poop bag, but I have to say, other dog walkers are always more than willing to share. So I think that is something that needs to be noted as well. But thank you for the report, and thank you to Seamus. Thanks.
Thank you, Sandra. Councillor Harkin. Sean.
Thanks, Chair. Yeah, look, thanks for the report, Seamus. And there's been a tremendous amount of work done on this issue, especially the dog fouling issue, over recent months. And I think it looks like we're making some inroads, but obviously it's not an issue that is going to be that's been solved. Getting people not to smoke indoors was not solved immediately. Having people wear masks to deal with COVID wasn't something that was uniform. A lot of education was needed, and there was plenty of people with high profiles that stood in defiance of all that. So it's going to be no different with dog fouling, unfortunately. So a couple of things, which is just, it does seem this is a campaign, and I believe that the educational component is the key. People being engaged and talk through, and having discussions with people about the impact of dog fouling. And the more that happens, I think that the more we win the argument about people not allowing their dogs to foul or not allowing their dogs to go outside the foul. But we are scaling back, it seems, the having council workers out there. I know that these were casual workers. I don't like the term casual workers, but this is a very important role. So I'm just wondering, in terms of, like, is that still the plan, to kind of scale back significantly on having people out there talking to people, which is probably the key way that we can do this. And then my second question is, and I raised this previously, I mean, I've spoken to people who've asked, can there be more bins placed inside, like, estates and so on? And is that something that officers are looking at? And would it be possible to get a map so we could actually see where the bins are? That might be a big undertaking if there's thousands of bins, but it would be useful to see kind of like visually where bins are located, just to kind of have a sense of how accessible they are to people in terms of their routes or dog walking at night and stuff like that. But thank you for everybody's efforts on this front. Thank you.
Just two more, Seamus, and then I'll come back to yourself, if you don't mind. Councillor Boyle, Michaela.
Thank you, Chair. First of all, just I want to congratulate everybody involved in the work that's been ongoing, obviously during the pandemic, and the staff that has been out on the ground. There was a marked notice in their presence, certainly across Strabane town anyway. I also want to take the opportunity to thank Brian Tierney for the initiative that he had brought forward also, and I know it was well received in Strabane town. But I suppose just Councillor Harkin has asked my question. There has been requests for additional bins, and I know myself, I have requested additional dog fowl bins and rubbish bins. And I noticed that they haven't been, the areas that I've requested haven't been allocated the bins yet. But I just want to know, Seamus, is there a delay maybe in the bins being allocated to the council? Because I know it was some time ago I've requested bins for certain areas, but they still haven't got them. So just want to know, is there some sort of a delay actually in the bins being brought to council for the communities that we've requested them for? Thank you.
And for now, Councillor Edwards, Stephen.
Thanks for letting me in, Chair, and like others before me, I thank Seamus for the report, and I do agree that the Mayor's awareness campaign as well as getting those casual leisure workers out definitely increased visibility. And I know that the fines are still sort of low there, but council could learn a lot from our North Down, and I mentioned it before to our committees that they're fining about 274 a year when we're doing about 4. So I think there's still lessons to be learned on it. And just on a few issues that I have visited on the stray dogs issue, I have visited Pet FBA at the Pound in Derry. They're doing a fabulous job, and I just like to put that in record. They're doing such a good job. In terms of the bins, I was going to raise that as well. And I do believe it's actually not under this directorate, it might be ENR, but I do believe that there's issues around footpaths in a lot of the estates not being wide enough to put a dog bin in. And I do think that there would be scope to put sort of, the smaller litter bins in there that could be emptied on a weekly basis that aren't as big and as obtrusive on the footpaths. But that's my comments. Anyway, Chair, thank you.
Thank you, Stephen. And Seamus, if you're care to obviously pick up and address some of the stuff that has been mentioned by members, please.
Chair, yeah, I'll try and take them in sequence. So first of all, in relation to Alderman Devaney's queries about enforcement, I suppose we continue to promote responsible dog ownership. We do have a zero tolerance enforcement policy, but it is fair to say that we do need to witness the offence in order to issue a fixed penalty notice and or take enforcement or prosecution. And there's two ways of doing that. Either the dog wardens witness the offence, or members of the public who witness the offence submit a witness statement, and we can take action based on that. We have a CCTV policy, and we install cameras in any areas where there has been concerns raised, and we'll continue to do that. And again, as outlined in the report, we intend to implement the Green Dog Walkers scheme, which hopefully will help raise awareness. It's fair to say that, I appreciate we have a small team of dog wardens. We did anticipate there'll be a lot more fixed penalties issued based on maybe the additional patrols, and there was 16,000 patrols in the last couple of months. We anticipate there would have been a lot more fixed penalties would come out of that, but that just indicates that you have to witness the offence, and those members of staff didn't witness many offences. So it is going to be very difficult, irrespective of the number of staff on the ground carrying out patrols. And so hopefully that answers the query in terms of enforcement and fixed penalties. In terms of licensing, we've probably close to 8,000 licenses. That's an increase in probably 2,000 in the last couple of years. But we do anticipate for the size of the population in the council area, there should be about 10,000 dog licenses per year. And we'll continue to try and ensure that we increase on that as well. Councillor Ferguson's query in relation to exotic pets and pet stores, I do need to look into that a bit more. My understanding in terms of animal welfare and wild animals, that is the PSNI are responsible. But Councillor Ferguson, I'll come back to you just to clarify on that. And we will follow up on the dog breeding establishments to make sure that they're licensed and liaise with the animal welfare teams on that category of premises as well. Councillor Harkin, in relation to the patrols, Councillor Harkin, yeah, the proposal was to scale back the initiative. We felt that the survey carried out has given us enough data and information to help improve the service, but we're also just mindful in terms of the recovery of other council services and to facilitate staff to go back to their previous roles. But obviously we can keep that under review. The bins in the estates, the patrols again, one of the questions that the staff did highlight was, or were asked to highlight was there adequate bins in particular areas that they were patrolling? So we have that data and we will liaise with the Environment and Regeneration Director just to ensure that there is adequate provision of bins, albeit there will not be bins probably in every estate or every street, but we want a proportionate number and we'll keep that under review. Councillor Boyle, hopefully that clarifies your query in terms of bins as well. We do intend to plot the bins on a GIS map and upload it onto the council website, and that should be available shortly. And I'll also liaise with the environment team just in relation to bins that have been ordered and maybe not installed yet, and I'll come back to you on that. And I think that's all of the questions answered, Chair.
Okay, Seamus, thanking you. And thanks to members for in relation to that particular issue. Folks, I'm conscious it's going on maybe close to 10 past 6. If we maybe come back for 6:25, like a break to 6:25. Okay, thank you. Hello, folks, we're ready to go. Karen, are we ready to go, council officers?
No, yes, we're here, Chairman.
No, that's what, no, that's no. So, okay. If we can move on to item 8, which is the update on public conveniences provision. And again, ask Seamus, please.
Thanks, Chair. The purpose of the report relates to a review carried out on public convenience provision in the council area. Members, you'll be aware that a member-led working group was established in September 2020 and recommendations were considered by this committee and ratified by council in December 2020. At that time, it was agreed that the public conveniences would remain closed to protect the health and safety of the general public during the COVID-19 pandemic. There's been substantial progress made in recent years with regard to ensuring hygienic, safe and accessible public conveniences are available across the council area, and this has been achieved in a number of ways, including implementing a community toilet scheme with 20 premises currently participating. Members, it's important to note that not only is this the most cost-effective way to provide access to public conveniences, it is generally accepted that the standards of hygiene within these premises are generally higher due to regular service and supervision. Council currently is also leading the way with the accessibility to change in place facilities. There are currently 7 facilities located within the council area with a number of new facilities proposed. This has been facilitated through the council's Access and Inclusion programme, which has secured approximately £250,000 in funding to install these integrated facilities in a range of cultural venues across the council area. Members, this provision is supplemented by other public conveniences within the council-owned public and community buildings, and not provided by businesses which are not part of the community toilet scheme. Members, if it was agreed by committee to reopen all or some of the public conveniences, strict hygiene and safety protocols would be required, including providing additional human resources and enhanced cleaning regimes, which would have a significant cost related to. The working group considered all of these issues and the recommendations fall into 4 main categories. And Chair, if you just bear with me, I'll run through each of them. The first recommendation relates to community toilet schemes. So as I stated earlier, we've got 20 businesses currently participating. Council officers carried out a scoping exercise in relation to alternative provision available in Crana, Barnes Gap, Plumbridge and Moorlock. Though the team will continue to encourage more businesses to participate in the scheme, they were unable to obtain willing participants in relation to those particular areas at this time. Expressions of interest have been received to join the scheme from premises located in Sion Mills and Dunnamana. We hope to have these businesses signed up shortly. Alternative provision is also available in Strabane, including the Alley Theatre and Strabane Library. A members' marketing plan is currently being developed to promote the scheme and improve signage. Chair, the second recommendation relates to change in place facilities. And as previously outlined, this is one of the areas that this council is leading the way on. The previous recommendation was that change in place facilities would be made available in Derry Valley Leisure Complex and Strabane Library facility. Although there has been a delay in providing the facility in Derry Valley Leisure Complex, it's anticipated this project will be completed this financial year. Members, the facility in Strabane Library has been completed and will be formally opened later this summer, and any future change in place provision in the council-owned buildings will be addressed by the Capital Working Group and proposals brought to the relevant committee for consideration and approval. The third recommendation relates to the rental of temporary toilet facilities, and the working group reviewed the provision and payment for renting temporary toilet facilities to groups and event organisers, and it's recommended that event organisers in receipt of grant aid pay for the rental of temporary toilet facilities, and that all other event organisers pay for rental of temporary toilet facilities from the 1st of April 2020, and that's just to enable further consultation to take place. And the final recommendation relates to the standalone public conveniences. And the recommendation is that the public conveniences in Sion Mills and Dunnamana remain closed. And members, although the report recommends that the facilities at Barnes Gap remain closed this summer, council officers propose to liaise with colleagues in the tourism department about future proposals to increase visitor numbers to the site as part of the Appalachian Trail, and bring back a report at a later date to the relevant committee. Members, council officers will continue to liaise with businesses in Plumbridge regarding participation in the community toilet scheme, though members may wish to reopen this facility subject to alternative facilities being made available. Members, it's also important to note that there are a number of other facilities in the tourist and park locations to be managed by relevant directorates in the council. And the public conveniences at Strabane town will remain closed pending demolition as part of the town centre public realm scheme. The public conveniences at Murlock, which are under Derry ownership, is recommended they remain closed and Derry consider future provision. And the public conveniences at Crana, the recommendation is they remain closed and future provision in this area be considered as part of any future proposals for the Spurn Heritage Centre. And council officers from both the Health and Community and Business and Culture Directorates will discuss future options and report back to council. It is also recommended that there be no sale or disposal of any of these facilities until community asset transfer avenue is explored. And finally, the public conveniences at Newton Stewart are to remain closed and a lease of the building is being progressed. Members, the report outlines the costs associated with providing public conveniences, including provision of temporary toilet facilities and the cost for delivering the community toilet scheme. If it's decided to permanently close public conveniences, there will be limited impact and staff have been consulted and will continue to be kept informed of the decisions taken by committee. It's also important to note that there are health and safety, infection control and other financial risks associated with reopening the public conveniences in the current pandemic, particularly given the uncertainty around the possibility of increased community spread of the virus. So members, it's recommended you consider the recommendations and agree the most appropriate course of action.
Seamus, thank you for the report. Already have a couple of councillors indicating they speak. Councillor Boyle, Kayla, please.
Thank you, Chair. And thank you, Seamus, for the report. Can you hear me okay?
Yes.
I was just having difficulties there with the internet. So, no, as I say, thanks for the report, Seamus. And I do know I wasn't on this committee whenever all of this was going on and consideration around public conveniences was taking place and you know, consideration within the working group and that. So I appreciate the work that has been done to date. However, I do have some concern. I know Councillor Dan Kelly also has raised with me some concern that he has under, I suppose, proposal 1, you know, in terms of closing all council facilities on a permanent basis. I do appreciate, Seamus, what we are trying to do here in regards to the community toilet scheme. But I suppose consideration has to be given for those in terms of there's no alternative suitable accommodation in the most rural areas for any alternative, particularly in Crana and Barnes Gap. So I've been speaking to Councillor Dan Kelly, and I know that he has wrote to the Chief Executive and to Karen in this regard. So obviously we would not be supporting recommendation 1 at this current juncture. To, you know, obviously we would want to scope out further, particularly with the DEA reps in those areas where this will be affected. So, you know, at the minute we would not be happy to support the recommendation as at number 1, particularly, as I say, around Crana and Barnes Gap, where no alternative provision can be made, you know, for that. And just in terms of saying and Dunamana as well also, Seamus, obviously currently it would not be safe to open under the current with things where we are at the minute. I suppose, you know, we just can't open the premises and have everybody come in and act as normal. There has to be strict measures in place around PPE and safe sanitising and all of that, and that has to be accounted for, and who be responsible for that, and I suppose staff and that. So I do appreciate that. More people are moving around now. People are out and about, and different events are happening, and we're being asked to stay at home and holiday at home, and so there will be more people driving around our rural areas. So just to say, Seamus, I do appreciate the work that's ongoing, but at the moment we couldn't accept, recommendation 1 because of the Barnes Gap and Crana issue. Thank you, Chair.
Thanking you, Michaela and Seamus. I have a number of speakers, so if you don't mind, I'll take a number of speakers and then come back to yourself. So, Councillor Doyle, Emmett.
Thank you, Chair. I'm not on the committee, so appreciate you allowing me to speak. It's in relation primarily to, I mean, I'm not going to get into the recommendations that'll be for members, but the community toilet scheme, in particular, I'm sure it works on a range of areas. But one of the things that I have raised, and a paper was brought back to ENR yesterday at my request, and I'll be discussing it at full council, is in relation to Ballyarna Country Park. Because when we look at it, the nearest community toilet scheme venue there is Northside Shopping Centre. Now there's a number of schools, there's a number of disabled people in the area who use the park. And when we look at it, I totally take on board that there are people here who represent largely rural DEAs where that would be a problem. But when I look, for example, at the way, further on at the Racecourse Road, the next thing you meet after Ballyarna Country Park is a border. This is a park that's on the outskirts effectively of the city, via that route at least, and expecting people to go back up to Northside to use a community toilet scheme isn't acceptable. So I do think we do need to start, having consideration as well to, this is not a project and not a program that suits every scenario, and we do have to be open moving forward to being more adaptable in relation to public conveniences. Thank you, Chair.
Thank you, Emmett. Alderman Hussey, Derek.
Thank you, Chair. Like Councillor Doyle, I'm not a member of the committee, although I did sit on the toilets working group. And I think Seamus can confirm I was possibly one of the first people who brought the idea of the community toilet scheme to the working group. And the rationale of bringing it was, its use in other areas. And I would pick out, for example, the southwestern parts of England and indeed Highlands and Islands in Scotland. But the community toilet scheme is not the complete answer. It's part of the parcel of provision that can assist us in providing a necessary service to not alone our own residents, but to those who would visit in the area. Like Councillor Boyle, would have great reservations about a general closure on a permanent basis. For example, Newton Stewart is mentioned later on, and the issues of the church perhaps coming in and taking over that particular property. As far as I know, it's actually leased from the Northern Ireland Libraries as opposed to being council property. I'm not 100% sure on that. But I'm thinking in terms of what would the church's intention be within their drawings? Are they proposing that there will be a toilet facility still there, that they perhaps could then enter into the community toilet scheme themselves with those toilets for that sort of provision? And if it were the intention to remove that public provision within Newton Stewart, what has the uptake of the community toilet scheme been? Because it's got to be a counterbalance situation. Seamus has mentioned the target of 20 being achieved. I believe there should be far more community toilet facilities throughout the district. But one of the issues with all of our toilets is directing strangers as to where they actually are. And it's a particular difficulty with shops within their premises have community toilet provision, and are being paid by council for providing that service on behalf of council. So the signage and indication of where the toilet facilities are, should it be public conveniences, should it be community toilets provision, and indeed should it be those businesses who willingly allow the general public to use the facilities on their premises. We need a system whereby it is clear and obvious where the provision is. So that's on the issue of signage, although signage is mentioned there with regard to the changing places facility, but I think it's important overall generally. Thirdly, with regard to the provision of temporary toilet facilities for events, part of the rationale is that when organisations apply for funding to assist with their events, within their application, they can include the provision of toilet facilities, or indeed hire premises, whatever else they're needed for the provision or running of their festivals, etc. So fair enough that if they receive grant aid, one would expect that would be contained within the application. There are many organisations who run events, however, and do not claim financial assistance from council, but the nature of their events is such that it's only right that council should proffer some sort of assistance to them. And one of the means of doing that at present is providing a certain number of temporary toilet facilities. And to put a cut-off date of the 1st of April on that is wrong. We're saying that from that date, rather than saying that the situation would be reviewed at that date, which would be a lot more satisfactory. See how things go over the summer when most of these events hopefully will be able to take place. See how it goes then and review it on the 1st of April, rather than say all other event organisers pay from the 1st of April. I think there's got to be some sort of consultation on that there. I think that's all of the issues that I had noted in that, with one exception, and that is, and I think it was Councillor Doyle referred to Ballyarnett, the potential for new toilet provision. Within my own electoral area, and I see a couple of councillors following me in this, there are a couple of areas where we're seeking that play parks, play facilities would actually be upgraded to district or neighbourhood type provision. That type of provision, one of the criteria would be that there would be toilet facilities available for the users of the particular park, should that be Castle Park in Castleberry, Bohanshome in Newton Stewart, wherever. So that has to be included there. And as others have rightly said, there's nowhere near where a community toilet facility could provide that service. So it's incumbent on council to consider that provision as part of the overall development of play provision, and that's been identified within the Play Board report. Thank you, Chair.
Thanking you, Alderman Hussey. Councillor Edwards, Stephen.
Thanks for letting me in. I agree with speakers before me, especially Alderman Hussey there. I don't think it's right to close toilets permanently, especially if no alternative is put in place. And I think that was the recommendation from the working group, which I chaired last year, and that was the recommendation. So I have massive reservations, especially around Crana and Barnes Gap, and Councillor Jason Barr has been on to me the last few weeks about that. He's getting constituents who are very concerned about the permanent closure of those toilets up there. So I agree with Councillor Boyle that we shouldn't be closing, especially where there's no, we shouldn't be closing permanently, especially where there's no alternative in place. And I agree with Alderman Hussey there too around the community toilet scheme. And I actually had to write in to council officers. I remember last year there's 4 businesses in Castleberry town signed up to it. I actually had to write to officers to get the details of where they were, because I couldn't find them online, or I couldn't find them in Castleberry myself. So that awareness reason needs to happen. I noticed in the report as well that the council are developing a marketing campaign. I'd just like to know where we are with that. I do know that for some businesses, the community toilet stream isn't attractive. I've approached a few myself and spoken to them about it, and there's issues with, for example, bars and shops. They say that it would restrict their right to refuse entry, which is a concern that they've raised. So I'd like to see or hear from Seamus to see if there's any barriers within local businesses, and is that way that some aren't coming forward in the areas where there's no alternatives. In regards to Newton Shirt as well, I believe that that's been closed for a few years, and I know that council are engaging with the Church of Ireland to take that over. I'd just like to know how advanced they are with that, because there's residents in Newton Stewart, especially those who use the library that's in behind it, messaging me. It's got very unsightly, and it can be an area for a bit of antisocial behaviour as well. So I'm getting messages from residents there in Newton Stewart. Changes placement facility in Castlederg. It is disappointing that it's been delayed, and I've been a council for a year now, and we have been promised it for a year, and I see it in Strabane Library, and it's great to see it go on, but I'd like to see some effort redoubled for Castlederg, especially given that the Castlederg public toilet was demolished last year. Rental of the temporary toilets as well. Agree with Alderman Hussey, and had it in my notes here as well. I think that it should be reviewed in April, rather than having a charge is brought on a specific date. So I think that should be reviewed. But that's my comments and concerns, Chair. Thank you.
Thank you, Councillor Edwards. Seamus, have two more councillors at this stage. If I could maybe take them and then come back to yourself and the Alderman Keith Kerrigan.
Thank you, Chair, for allowing me in, and I wish you well, Chair, in your year ahead.
Thank you.
Your Deputy Chair, my colleague Alderman Devaney, and his term as your Vice Chair. Chair, very much I'm going to be singing off the same hymn sheet here. That the Toilet Working Group was very heavily influenced by, I suppose, their DA members. And to be fair, I'd be agreeing with a lot of what Alderman Hussey and what Councillor Edwards have stated in regards to it. Not just keen here on the full closure. And again, I was looking through the list of those businesses and who are included on the community toilet scheme on the council website, and I seem to be seeing none at all in Newton Stewart. Now maybe I've missed, but I don't see anyone in Newton Stewart, signed up to it. And as Alderman Hussey stated, I don't want to reiterate too much, but it's all tying in together. It's the likes of the neighbourhood play parks, and again, Vaughan's Home, as one that's been mentioned, could be neighbourhood. And I know that's not this committee, but again, toilet facilities. If you're looking to bring children and young people there to them sort of areas, you require those toilet facilities. And again, for those people with more elderly people or disabled persons, so you've got to have that. That's again for the castle site, and again, as we had mentioned that in the castle site, and I believe that came up at a previous committee, that the money just wasn't there to go ahead with the toilet block potentially at this stage. But and again, Sion Mills and Dunnamana are mentioned there as two areas there where we have stated that there has been an interest in joining the community toilet scheme. I'm wondering how many businesses or organisations are willing to sign up. I mean, if we're talking about just the one, are we talking about a number? It's just to get a wee bit of detail on that, because I wouldn't want to be just deemed to be closing permanently. Sion and Dunnamana, I wouldn't be in favour of that. I would need a wee bit more detail. And the other thing then, Chair, I just had down, the temporary rent, or the renting out temporary toilet facilities. To be fair, Chair, when an organisation or a group or community group are running a festival or an event, when they are pushing to get toilet facilities brought in, I think it's a credit to them, because I mean, there's nothing worse than seeing men up against the bushes and all that. It really puts people off on events and different things there. And when they're going to the extent of organising a lot of these groups, there's no money there anyway. It's a lot of voluntary groups that are organising these events, and I wouldn't want to be putting a barrier in place for them seeking to bring in toilets. that the council could potentially provide. But thank you very much for allowing me in, Chair. Thank you.
Thank you, Alderman Kerrigan. Alderman Devaney, Morris.
Thank you, Chair, for allowing me in, and very supportive of quite a number of the speakers there in item 1. And I'm going to be parochial here, Donnamana area. When we look at the site at the moment where the Donnamana one is, we have the local mart there, which is used nearly every weekend, maybe a couple of days every weekend. While I appreciate there's interest in the community toilet scheme in the area, I appreciate that, but you know, when you have maybe 500-600 farmers coming to an area, you can't be pushing them through shops, and we all know what farmers are when they work with sheep and cattle. The other thing that I would like to say, Chair, I have to say over my years as an elected member, I have to say events that have been held by, you know, where we have supplied as a council toilets to groups out there, we have got accommodation for that. And respect for that, and I think we shouldn't break that circle, because we talk about groups that are funded. As you know, Chair, many of the groups out there carry out events on a shoestring budget, and some very, very fine budgets, maybe £500 or £1,000. So there is no capacity in there for toilets, for portaloos. The thing that I would say is, you know, we always hear complain about people urinating in public, and I believe the council giving these toilets to organisations out there was a very, very positive story, because we were seen as a council to be proactive in dealing with and supporting our programmes of events and other events that are ongoing, and it was just, Chair, to have, you know, to try and deal with the issue of public urination. So like other colleagues, I wouldn't be supporting the recommendation, Chair.
Thank you, Morris. Councillor Kearney, Brian.
Thank you, Chair. If you just bear with me there, I flick over the page here. Thank you, Chair. Chair, I'm slightly confused here. 3.4 of this paper, the working group considered the financial and other related issues to the future of public convenience provision, and then it goes on to point out what the recommendations are. So at the end of recommendation 1, it says there are public conveniences currently provided, and there is a proposal to close council facilities on a permanent basis. So, Chair, it doesn't say what, or maybe I have missed it, what the other issues related to the future of public convenience provision are. And from what I'm hearing, Chair, and I hope you'll agree, all the councillors who I've heard speaking are against the recommendation at number 1. So where did the proposal to permanently close the council-owned facilities come from? Because there doesn't seem to be anybody who's advocating that at the minute. So, as I say, maybe I've missed it, and if I have, I apologise, but I would just like that cleared up, Chair, please. Thank you.
Okay, Brian, I'm going to ask Seamus to come in. Obviously, there's a number of issues raised there, and not least what you have articulated there, Brian. So I'm going to ask Seamus to come in, but then obviously as a committee and what's in front of us, and people have made a number of points and what they would support and in some degrees what they wouldn't support. So we obviously need to hear what the officer Seamus has to say, and then we need to come back round to making decisions one way or another.
Thank you, Chair, and I'll try and take them just in order. In terms of Councillor Boyle's query, it's noted in terms of recommendation 1, and I suppose it's probably fair to say that the working group did talk about closing public toilets, but it also talked about carrying out a scoping exercise to look at alternatives. And yes, we obtained alternative provision within a couple of those areas and not in others, and that has been clarified in the report in terms of Mills and Donnamana, but not for Barnes Gap, Bridge and Murlock. It's important to note that Crana had already been closed, and that had been agreed at a previous committee, but I take on board members' comments in relation to those areas. I also did outline in terms of Barnes Gap that we would liaise with the tourism department in relation to that area being a visitor site and what their future proposals were for it. In relation to Councillor Doyle's queries in terms of the community toilet scheme and reference to Ballyarnett Country Park, I'm unable to comment on that and understand the paper has went to the ENR committee. In terms of Alderman Hussey's comments, and yeah, we will continue to promote the community toilet scheme, and as outlined earlier, that would be the preferred model going forward. There is a marketing plan being developed at the minute, and again, that will take on board members' comments today. And we will look at signage, and the website has been updated to incorporate all those premises that are members or have signed up to the community toilet scheme. In terms of the temporary toilet facilities at events, by all means, it was just, I know this was discussed at the working group, it is just to ensure that there's consistency of approach. Currently that isn't in place, and that's the reason why that recommendation was put forward. And by all means, we can change that to review in April 2022 rather than payment from April 2022. And in terms of the potential for new toilet provision in play parks and tourist attractions, again, they would probably need to go through the capital working group and budget being considered, and then obviously a report brought back to the relevant committee. In terms of Councillor Edwards' question, the community toilet scheme, as I said, those details are now online, and any queries that we receive, members of the public are directed to the council website. I would stress that the toilets have been closed for an extended period of time, and the Health and Community Department have not received many queries in relation to them being closed or concerns raised. Again, the marketing campaign we will look at and take on board. Newton Stewart Public Toilets, there has been a meeting with Libraries NI and also with the church, and legal will progress in terms of that agreement. Whether that facility will become a member of the Change in Places facility, we really don't know at this stage, and that can be discussed with the leasee. And I think a number of references made to the rental of public toilets, and hopefully I've covered that. And Alderman Kerrigan, your query in terms of Sam Mills and Donamana, my understanding is I think 2 businesses in each of those areas willing to or expressed an interest to participate in the community toilet scheme. And in relation to play parks, unfortunately, I can't comment on that. That would be within ENR. And Alder Devaney, I take on board similar type questions, take on board your comments. And Councillor Tierney, in terms of the recommendations, we had, I think, 4 meetings, and we reviewed all of the issues in terms of the financial implications, COVID-19, and the community toilet scheme, change in place facilities, and again, that's where those recommendations have come from. There's probably just a slight misunderstanding in relation to the scope and exercise for the community toilet scheme in Crana, Barnes Gap, Plumbridge, and Murlock. Thank you, Chair.
Okay, Seamus, thank you for that. People may have noticed that Councillor Boyle, Michaela Boyle, has a proposal to the chat box, and it's seconded, if I'm reading this right, by Councillor Edwards Stephen. So if people want to maybe take a look at that, and again, and it's not for me to, in one sense, but does this proposal come in terms of we have a report in front of us with a recommendation. I know people talked about different issues within the report, and there was obviously articulated an outright opposition to point 1. So was this proposal in relation to, and I see people looking in the letterman, is this proposal to, in the event of the report being held or being held until this meeting takes place? Just a thought in terms of trying to move this thing forward. But there's a proposal in there, proposed and seconded, and I now have speakers looking to speak in terms, and Alderman Hussey, Derek.
Thank you for allowing me in, Chair. As I've said, I'm not a member of the committee, but I agree with the proposal. I would support it when it goes to full council. I think one of the issues is that the overall issue of toilet provision is extremely site specific. Therefore, it is logical to look at it on an area by area basis. Thank you, Chair.
Thanking you, Derek. And again, folks, if I could direct people to the chat box if they're not already seeing it in terms of, and just to try and get my own head around this, Alderman Devaney, is that an amendment to Michaela's proposal?
Yes, I think it's important, and look, I have no problem in supporting the proposal coming forward here, but I think to address the interim measure about these portaloos for groups that may ask for them, that we continue to supply those groups with the portaloos. I think it's important. Maybe Michaela would, I think it was Michaela put the proposal forward. Would she accept that onto it as an amendment?
Yeah, happy for a review. I see Sandra has wrote in the chat box here.
Yep.
A review of that. Happy for that. Yeah, yeah.
And sorry, Councillor Duffy, Sandra, is yours tied into the Michaela's as well?
Chair, it was in relation to the rental of portaloos to small groups. I know that there would be a significant amount of small community organisations that would rely on them for events and stuff, so I would be reluctant to see that change. Now, I understand the reasoning behind it in terms of consistency. So if that needs to be reviewed, let's review it, but let's not throw the baby out with the bathwater. So happy to second Alderman Devaney's amendment.
Okay. Okay, folks, proposed and amendment proposed and seconded. I don't hear anybody making a case in any other direction at this. Give me two seconds, Alderman Hussey. If I could direct officers to Alderman Hussey's for clarity. Is that in terms of the chat box, or for that matter, other members, in terms of proposal and amendment? Now beginning the question, am I making sense?
Chair, I suppose from my perspective that there's been a substantial number of issues raised by members, and I think given the detail of the inputs across the chamber tonight, I think as an officer team we probably need to take away all of the recommendations, review them in full, to make sure that we've got total clarity and bringing you back any further proposals. So we're content. The paper is there for consideration tonight. If you want to defer the implementation of any of those recommendations till we've gone through those considerations right across the board, we're content to do that.
And DC, just on that, Karen, just to be clear, because in one sense there is proposals are in there in terms of the would appoint a further meetings and further discussion. Is the council officer team okay to include that in the deferral?
Yeah.
Is that okay?
Yeah.
Is that okay, members, or?
Happy for that, Chair.
Okay. Sorry, go ahead. Okay, agreed. Sorry. Okay, but can we leave it at that? Deferred, and obviously the meetings take place, and the issues that have been raised by members today further discussed. Is that okay, members? Okay, moving on. Sorry, Councillor Councillor Edwards agreeing.
Yeah,
okay.
Chair, sorry.
Sorry, can I? Who's that? Okay, okay, folks. I'm taking.
I was just agreeing, Chair, that's all.
Okay, it's I'm not that used to people agreeing with me. I need to hear it 3 times. Okay, right, folks. We'll move on to item 9. And hello. Can I move on to item 9 and ask Barry to take that, please?
Thanks, Chair. Members, the purpose of this report is to update you around money received from the Department for Communities for our Neighbourhood Renewal Active Citizenship Through Sport programme, which has been ongoing for the last 10 or 12 years, and to seek members' approval to work with the relevant neighbourhood renewal partnerships to develop and deliver action plans for delivery of the Neighbourhood Renewal Active Citizenship Through Sport programme. Members, you'd be aware that this is a programme around delivering accredited sports and generic coaching courses to allow people to deliver and add value to new or existing coaching and physical activity and exercise programmes within the 5 neighbourhood renewal areas. And it's delivered through a partnership approach between Council, DFC and the 5 neighbourhood renewal partnerships. 10,000 of that is training costs, with the remainder for programme costs. The programme budget you'll see in section 3.2, and you'll see in section 3.3 each of the neighbourhood partnerships will develop agreed action plans, and the delivery organisations will deliver those within a service level agreement each of the respective neighbourhood areas. So members, in terms of recommendation, that members approve the delivery of the Neighbourhood Renewal Active Citizenship Through Sport project for 21-22, and that members approve this issue of service level agreements to the named organisations in section 3.3 with the associated budgets that have been allocated. Thanks, Chair.
Thank you, Barry. Councillor Burke, Tina.
Thanks, Chair. And just before I started, I meant to do it earlier. I just want to add to the comments from the other members this evening and just wish you luck in your years, Chair.
Thank you.
Just happy to propose the report. I know the benefit that this funding has brought down to these areas in terms of not just getting people trained up and obviously delivering the programs, but also providing then the support then on the ground and the programs on the ground to the young people. So it's a 1-1 really. It helps towards obviously capacity building for those get involved in the training element, and then obviously the community then who benefits from the program. So happy to propose and welcome the report.
Thank you, Tina. Alderman Devaney, Morris.
Thank you, Chair, for allowing me in, and I have no problem seconding that proposal and welcome the recommendation here coming forward. Many people will benefit. The only thing, Claus, I would ask, I always harp about, Chair, as you know, being a rural councillor, if we had someone like that in our rural villages, we would be happy. But happy to second it, Chair.
Thank you, Morris. Alderman Hussey, Derek.
It's the same song been sung, or maybe it's the chorus to the song you just heard, Chair. Absolutely no issue with the NRAs receiving the support, and we'd welcome it. But I wonder, would there be a potential for officers to develop something similar internally, to work in partnership with the 3 rural local community growth partnership boards? That could be the avenue whereby something could possibly be developed. I realise there'd be a funding issue, but perhaps officers could investigate the potential for funding for a very similar scheme to be developed that would service the remainder of our district council area. Thank you, sir.
Thank you, Derek. Councillor Tierney, Brian.
Thanks a million, Chair. Just to again support the the recommendation from officers like others. I have seen over the years people on the ground actually benefiting from this funding. And I think it's a great way to get people engaged and get people out and get people active again. In relation to Alderman Hussey's, I don't know whether that was a proposal or just a suggestion, but we'd have no issue in looking to see if there is any way that similar funding can be found for the rural area partnerships, and would look forward to seeing that coming forward. Thanks, Chair.
Thanking you, Brian. Councillor Ferguson, Rachel.
Thank you, Chair, and I welcome the report. And I suppose, like my fellow rural councillors, I just wanted to query why it is just seems to be excluding the 3 rural DEAs, and ask Barry if there is even a similar project in which council or DFC are doing for the rural areas, because I think it's a fantastic programme, but it should also be done across the entire city and district and the rural areas. Thank you.
Thanking you, Rachel. Councillor Harkin, Sean.
Thank you, Chair, and thank you for the report. And we believe that the department should be funding community resources and community amenities as much as possible, and bringing life and education and programs and all sorts of activities. And we need much more of that. And so we will be, it's good to see money going in there. And obviously, say it again, these services need to be available to everyone in the community. They need to be accessible to all. And that needs to be, we need to say that over and over again. And I would concur with colleagues or other councillors and aldermen asking about a similar programme of funding for rural areas. Can we get an explanation as to why that isn't there? Thank you.
Thank you, Sean. Could I hand it back to yourself, Barry?
Thanks, Chair. Just to answer all of the queries, it's funded through the Neighbourhood Renewal Programme only, so it can only be spent in the 5 neighbourhood renewal areas within the district. We as an officer definitely could work with the team within the rural areas. If we had the fund, we've tried to explore this previously with other government departments, so we could definitely run a programme, but we'd have to be added to the rates estimates for our members consideration as of next year, but we could definitely look at that.
Thank you, Barry. Barry, could I bring in back in again, Councillor Tierney, Brian?
Thanks, Tony. Hold it up. Just noticing the chat box that Alderman Hussey has said that he's not a member of this committee. So just to, I suppose if you need a proposal for his suggestion that officers investigate the possibility of running a similar programme in the rural areas, I would be happy to propose that, and that a further paper come back to this committee with the possibility and the options available.
Thanks for that, Brian, and that's seconded by a couple of councillors, but Councillor Edwards was there first. So if that's a proposer and a seconder, alongside the reporter, people happy enough to move forward on that basis? Okay. Thanking you. If I could ask Barry again in terms of item 10.
Thanks, Chair. The purpose of the report was to seek members' approval for the recommendation of the Community Support Fund Grant Aid, to seek members' approval for the recommendations of the Good Relations Fund, and to seek members' approval to extend the COVID-19 Food and Essential Supplies Transition Fund spend by, and apologies, Jared, Chair, of a real bad migraine. I'm going to ask Karen if she could present the report of a very sore migraine. If she could present, please, just for
Okay, Barry,
please.
Okay, you're okay. You're okay.
Chair. So obviously the grant aid report is tabled. We're seeking approval for the recommendation of the Community Support Fund grant aid assessment panel recommendations, and also the same approval in terms of the panel's recommendations for good relations. And I suppose finally, members, at 1.3 to seek approval to extend the COVID-19 food and essential supplies transition fund spending by an additional 3 months. It's not additional approved money, it's extending that period of spend until September 2021. So members, you'll be aware of the history behind our various programmes and the financial allocations and the funding formula mechanism around deprivation, population and rurality that is applied to the allocation of our funding. So under the community support programme, not-for-profit organisations can apply for grant aid up to a maximum of £4,000 in any financial year. And that funding can be utilised for either core costs or project budgets. So as with all of our grant aid programmes, we do have limited financial resources available to support those, and obviously a very extensive demand to draw upon that funding. So the budget in respect of this programme is £214,500. Under the Good Relations Programme, you have the opportunity for constituted not-for-profit organisations again to apply for core and project costs up to a maximum of £4,000 funding, with a total available budget of £200,000 and the same demand in terms of the overall number of applicants to those particular programmes. So we do advertise our grant aid programmes by means of an open call. You will see there were 91 applications received under both funds. Received under the Community Support Fund and 65 under the Good Relations Fund. All applications are required to score above the threshold as indicated in the report. And so outlined in key issues are the requested number of applications, the total value of those applications, the available budget, the number and the amount of value above threshold, and the total recommendations. So rather than read through the detail of those, I'll take it that as papers have been issued, that you have that information available to hand and have had an opportunity to review it. There are no further equality, rural needs, climate change or data protection implications arising from the report. I've referenced in earlier discussions the financial implications of allocating the £214,500 for community support and the £200,000 in terms of good relations. Obviously, these allocations are subject to Council receiving our contract for funding from the Department for Communities, Voluntary and Community Division and the Executive Office, who support our Good Relations programme for the financial year. So members, if you bear with me, and note the decisions of the assessment panel for community support funding as detailed in Appendix 1 and the Good Relations funding as detailed in Appendix 2. And extend the COVID-19 funding by an additional 3 months with expenditure due by the 30th of September 2021. So members, those are the recommendations arising from the panels for your consideration and approval.
Thanking you, Karen, and hopefully Barry's severe migraine goes quickly. Just to draw people's attention to a couple of things, there's been a couple of expressions declaring an interest in terms of from Councillor Ferguson, Rachel, and Councillor Burke, Tina, Alderman Devaney, or Alderman Hussey, sorry, has put in a comment in relation to the programme. And if I could ask Councillor Duffy, Sandra, who's asked to speak on it.
Thank you, Chair, for allowing me in, and I completely welcome this report. It is significant funding for our DEAs, and I know that there are a number of projects that are sitting waiting for the outcome of this to arrange their summer activities. So I have no hesitation in proposing the report. I would also say that I do have an interest, as I'm on the board of On Street Community Youth, but I don't believe that it's a conflict, as it's not a pecuniary interest. So I'm content enough that I can propose and vote on the paper. Completely welcome it. Thank you, Karen, and thank you, Barry. Hope you come round. I suffer from migraines too, know what they're like, but no, happy to support the proposal.
Again, an expression of interest from Councillor Harkin, Sean, and asked Councillor Tierney, Brian, to speak.
Thank you for bringing me in, and I suppose like Councillor Duffy, I'll declare an interest as a board member on street community use, but like Councillor Duffy, I don't think it's a direct conflict of interest. I also welcome this proposal and this funding coming forward. This is the funding that we see actually on the ground and helping to tackle some of the issues that we're often on here giving off about in relation to antisocial behaviour and things like that, engaging young people over the summer months. And I think it's great to see, and it's great to see that there's been so many applications from so many groups from right across each and every DEA in this council district. Thanks to Karen and Barry and all the team for bringing forward this proposal, and hopefully we see this money hit the ground sooner rather than later, Chair. Thank you. But happy, Chair, just happy to second the proposal from Councillor Duffy as well. Thank you.
Thanking you, Brian. Alderman Devaney, Morris.
For allowing me in, and I have no problem, Chair, in supporting the recommendation. Very much welcome money coming out on the ground at the moment, and the sooner we get that out, the better. And I know there'll be a lot of interested organisations waiting to see if they have were lucky enough to receive it. And I just read through, there are some there, Chair, made the score, made the percentage, but just because the funding had ran out and they won't be able to get any funding. But you know, this is a broad spectrum here when you look across all the DEA areas. So it's very, very welcome, Chair, and fully support it.
Thanking you, Morris. And as it stands, folks, I don't have any other people down to speak, but from what has been said, I don't hear anybody speaking against it. It's proposed and seconded. And unless there is, if people are happy enough, if not, please let me know now. Okay, proposed and seconded and passed. And moving on to item 11, Karen.
Yeah, Chair members, the report is to seek approval to scope out options and indicative costs to address the issue of the aggressive footfalls from the Patricia Villas and Mulgrave Strabane, which is creating some issues for adjoining residents. You'll be aware that obviously in considering the implications of that, we will take into account health and safety advice, look at potential solutions to include ball stops and netting over the facility, with the intention of providing a more detailed assessment of what might be required to members for consideration. Obviously this is work that sits beyond existing budget, and obviously we will need to plan as to how that might well be funded. So at the moment it's a scoping exercise, so there are no additional equality, rural needs, climate change or data protection implications. As I've said, health and safety and financial matters will be addressed and reported on. Members seeking your approval to undertake the scoping exercise.
Thanking you, Karen, for the report already. Oh, sorry, it was posed in the chat box by Councillor just before the Councillor Barr, Jason.
Thank you, Chair, for letting me in, and thank you for allowing me to speak, as I'm not a member of this committee, and I wish yourself all the best for your year ahead, and also the Deputy Chair. Can I thank Karen and her team for bringing this report forward? I spoke to Karen not that long ago on this exactly regarding this. Can you hear me okay, Chair?
Yes, it's a wee bit breaking up, Jason, but...
Okay, can you hear me okay now?
Chair, I'm not sure whether there's somebody not muted in its background or whether we've got Jason back.
Is that okay now? Can you hear me now?
Yeah.
Karen, I think Paul's internet. Yeah.
I think Brian might be. Oh, he's muted now. That's okay.
Jason, Councillor Barr, Councillor Edwards, Stephen.
I don't think Councillor Barr finished his speaking there.
No,
Back,
no,
Chair, if you can hear me now.
I can hear you clear,
Aye.
Jason. Is
I
that
don't know what-
go ahead?
No, just to go back to the start, just to say thanks very much, Chair, for allowing me in, as I'm not a member of this committee, and just to wish yourself all the best for the year ahead, and to also the Vice Chair. It's just to thank Karen and her team for bringing this report forward. I spoke to Karen quite recently on this regarding the issues from number 1 to 4 Drumralla, who's experiencing footballs been kicked over the fence, obviously not deliberately, but just during amateur football matches and whatever damaging property, and people and residents afraid to go out to their backyard and during these such matches. But it's just look to thank the officer team for bringing this forward, and I look forward to the proposals, the next report coming forward with the proposals on it to take this forward again. So thanks to Karen and the team, and again, Chair, thank you so much for letting me on. Thank you.
Thank you. Councillor Barr, Councillor Edwards, Stephen.
Yeah, I was just happy to endorse what my colleague Councillor Jason Barr said there and propose the recommendation. Thank you, Chair.
Thank you, Stephen. Councillor Boyle, Michaela.
Thank you, Chair. No, just to say, happy to endorse the proposal. This was an issue I raised back away a couple of years ago when the park first opened. In terms of ball catchers netting across the pitch. I've witnessed not just the balls going into the houses, but going onto the road also, which cars having to stop very abrupt along the main road, along that Lisky Road or Drumralla Road. So it's welcome, and I welcome the report to scope out funding to deliver this. So I look forward to another report coming back with costings and hopefully getting something in place. Thank you.
Thank you, Councillor Boyle. And we have a non-pecuniary interest declared by Alderman Hussey. Derek, were you looking to speak there, or?
My mistake, Chair. It's for a later item.
Alderman Hussey?
Sorry, Chair. It's for a later item.
Okay, I'll maybe just deal with this one now then, if it's okay. It's proposed and seconded, and I don't hear anybody speaking against it, so if we can take item 11 as passed, folks. And moving on to item 12, and that's Karen.
That was item 12, Chair. Item 13. Yeah.
That was item 11, Patricia Villa's multi-use games area, was it?
Our numbers are different on the iPad, but according to the iPad, we're on number 13, which is a PCSP, Chair.
Okay.
Chair.
Yes.
Chair, I know you're getting on. There's Alderman Kerrigan here. Thanks for allowing me in. Chair, if everybody's content, I am content to make the proposal or make the nomination of Alderman Maurice Devaney on behalf of the DUP to become chairman of the PCSP for the incoming term. Thank you, Chair.
I'll second that, Chair.
Okay, proposed and seconded. Anybody else wish to speak to the issue? Councillor Harkin, Sean.
Yeah, a couple of issues on this. I mean, people may be aware that the PSNI are engaged with the Israeli police and prison service via the Horizon 2020 program that's run through the EU. And this is of great concern to the BDS movement across Ireland. And indeed, people are calling for an end to this collaboration between the PSNI and the Israeli prison service. And obviously, our council position is in support of BDS. So implementing BDS would mean that we couldn't support such an arrangement. So what I would like is for the PCSP board they agree that this will be discussed at the next meeting. I think it's an issue of great importance for anybody that supports BDS. We can't join rallies, issue statements, and then not talk about something like this. So that's the first issue, Chair, I wanted to raise in regards to this, which I think is of concern. And obviously, there's been more spotlight on the PSNI as a result of the PPS's decision to drop prosecution charges against the Black Lives Matter organisers and people who participated. And it's been now categorically agreed that there was discrimination towards the Black Lives protests, and there's a serious problem of institutional racism. So wherever you see discrimination at home, you also find it abroad. And I have to say, I and many other people were alarmed at the reports that were broke through the detail in the last week about the PSNI's involvement in training the police in Oman and what has taken place there over the last week. There was massive protests in the last week in Oman, mostly by young people protesting unemployment. And there was a full-scale crackdown by the Omani police involving beating people up, arresting people, putting people into detention centres, and an attempt by the government to suppress the news of the protests and what the government did and what the police has done. And there has been civil rights groups in Oman, Amnesty International, Amnesty NI have called for a full review and investigation into this. And what we find is that the PSNI have actually been out training the Omani police. They were out there in December 2020 right through to February 2021, training the Omani police in preparation for what the Omani government knew was going to be large-scale protests against unemployment. I think that this is a serious, serious problem. And I think we cannot overlook it and act like it's not happening on our watch. So I think that there are questions to be asked at least about this. So there are different organisations and people who have some responsibility. The Northern Ireland Overseas Cooperation Overseas, Invest NI, the Minister for Justice and the Minister for the Economy have all been listed as people who are knowledgeable and involved in the PSNI's role in Oman. And I think as a council, we have to be looking at this, trying to find out what's happening. We can't talk about democracy and civil rights here and then, have the PSNI operating overseas, working for a government where there is no democracy, and training people to basically violate their human rights. So I would propose that the council agree to write to the NICO, to Invest NI, to the Minister for Justice, and to the Minister for the Economy, asking for a full explanation of their knowledge about what the PSNI have been doing in Oman, and what their responsibility is to it. And I'll just put that in the chat here.
Sorry, Sean, I didn't mean to cut across you. I don't want to cut across you. A couple of things. There's a point of order from Alderman Hussey. Alderman Hussey.
Chair, I need your clarification. I'm not a member of the committee, therefore can I raise a point of order?
You're asking the wrong person. Okay. Can any of the officer corps clarify?
Chair, I'm assuming, I suppose, what is your point of order, Counter Hussey, firstly?
The relevancy of the last tirade that we've had to the actual item that's under discussion. Thank you, Chair.
And I presume that is a matter for the chair of committee?
Correct.
Okay. Shauna, I have your proposal in chat box. People can see that in relation to the proposal. I have a few other speakers here. I'm sorry, Sean, you didn't get to finish.
I was
Councillor,
done. Thank you.
I said you finished. Councillor Doyle, Emmett, and sorry, the other point to make, sorry, I meant to make this point. I declare an interest as a member of the PCSP. Councillor Doyle, Emmett.
Thank you, Chair, for allowing me in. I want to congratulate, I suppose, Alderman Devaney for taking up his position. It's not I wouldn't sit on the PCSP, but you know, I don't want to take that away from him. What I would say is that it's the just while he takes up this role, that it is a corporate position of this council, that we have censured the chief superintendent in Strand Road and demanded that he come back and report to this council on the tactics utilised by his officers, and we've been over this 1,000 times previously. I spoke to staff as recent as this morning to double check if we had received a response to our letter demanding that he come before this council again and answer questions, and I'm told that we haven't got a response. So I would urge the new chair of the PCSP, when he is engaging with the chief superintendent, to remind him that this isn't going to go away. There are going to be always people like me and others who are going to demand answers from the PSNI, and we will get them by hook or by crook. And if, as the correspondence we previously got from the chief superintendent indicates, that the PCSP is all powerful when it comes to accountability, I would ask that the new chair ensure that the chief superintendent come back to this council as we've demanded. Thank you.
Thanking you, Emmett. Councillor Duffy, Sandra.
You, Paul, for allowing me in. I'm not going to rehearse the PSNI stuff in terms of their involvement in Israeli forces and training there. I do fully support the BDS movement. I am also a member of the PCSP, so I will declare an interest there. I do think that the PCSP is a structure. It's a structure that has been put in place to hold the police to account. So we can't talk about policing issues on one hand and then not use the mechanisms that are there to hold them to account. So if there's issues there that we need to be raising, then through the PCSP is the mechanism that we should be using to raise them. So I have certainly no issue in raising the BDS through the PCSP. Absolutely no issue in that. In terms of what has been happening in the civil rights breaches that we have seen throughout the world, injustice anywhere is an injustice here. So we do have a responsibility to challenge it. In terms of the proposal that Councillor Harkin has placed before us, I have no issue in supporting it, but I would say that it is a substantial motion, and it probably should be brought to full council to allow people the opportunity to look at the issues behind it. I am aware of the issues behind it, but I would also know that other people aren't. So that would be my only concern around it. But if it comes to it, I have no issue in supporting it and voting for it. In terms of Councillor Doyle's point around the area commander approaching the council, yes, that is the position. But at the last PCSP, I have also asked that we hold a PCSP meeting in public to allow the public to see what is going on and to engage in what's going on, so that they have an opportunity to see how the PCSP can hold police into account as well, because those are the mechanisms that have been put in place. And just for the record as well, there are independent members on the PCSP. They have been recruited. They have gone through an interview process. They have gone through an extensive process in terms of getting to that point of being on the PCSP. And they were very hurt and annoyed that they would be cut out of any process in terms of holding the police to account by cutting out the PCSP. So I think that people need to hear and understand that as well from that point of view. But in terms of Councillor Harkin's proposal, I will support it if it goes to the floor, but I would have concerns that it probably should go to full council. Thank you.
Councillor Tierney, Brian.
Chair, thank you for allowing me in, and like others, first of all, just to congratulate and wish the incoming chair of the PCSP the very best of luck heading into his new position. There's no doubt that the PCSP is going to have some very difficult issues over the next number of months to grapple with, and I genuinely wish him all the best in that role. In relation to the proposal that's before us, I suppose really, Chair, it's an issue for yourself on whether or not you're going to accept it, first of all, but just we have no issue in supporting it if you do accept it. I am aware of the issues, and as I see it, and no way am I trying to teach my granny how to suck eggs here, Chair, but as I see it, it's asking the council or asking this committee to write 4 letters to find out what people's knowledge and responsibility was in the lead up to the PSNI providing this training. So we have no issue in supporting that and finding out and getting that information back, and then we will move forward with it then. As others have said, you know, I fully support the BDS movement, and if they're looking for answers, then we should be doing all we can to find them. In relation to some of the points that was raised around the PCSP and their ability to hold the district commander and the PSNI to account, I have no issue with that whatsoever, and our party fully participate in the PCSP and other structures that are there as well to hold the PSNI to account, and we'll continue to do that because we feel it's a very, very important role. But Chair, I would like to point out that whilst those structures are there and in our opinion worthwhile, they're not limited to holding the PSNI to account either. This council, I believe, have a role in doing that also. And when we supported the calls for the district commander to come to the council, we weren't snubbing by any stretch of the imagination. We weren't snubbing the independent members of the PCSP. There is also a role, I believe, for the PCSP to hold the district commander to account, and they should be doing that. But that shouldn't prevent this council from holding him to account as well. And I think that needs pointed out. There's no reason why both of those processes can't work together in tandem. And I think that needs to be pointed out. But the main focus of the PCSP should be tackling all of those issues, but it shouldn't prevent this council from addressing them either and addressing them with the district commander if this council agree that that's the direction that we want to take, which we already have. But I think it's important to point that out, Chairman. But in relation to the proposal before us, as I said, I think it's a decision for yourself first and foremost, but whatever way you do it, we will deal with it in that vein, Chairman. Thank you.
Thank you, Brian. Thanks. Alderman Devaney, Morris.
Thank you, Chair. And look, I've listened to Councillor Harkin, and on many issues, if I know our party or even a member of our party have any issues with the PSNI, we go and we meet them and we have it out with them. And I have to say, Mr. Chairman, as you quite rightly know, you're a member of the PCSP and others on this committee here, we do ask the questions. And the problem being for us on the PCSP, because of COVID, the meetings are not open to the public, but it is something that the PCSP is looking at. And as soon as the regulations allow us to open the meetings out into the public domain, that will allow members of the public in to come and see the issues that we discuss. And I can assure Councillor Harkin, we do hold the police to account. And on the commander not coming in to the full council meeting that he was invited to, yes, he was questioning around that. And, you know, I know I raised my concerns and around the issue that I thought he should attend. Should have attended, and I said it at the full council meeting, because you have people like yourself, Councillor Harkin, and others maybe who are not on the PCSP, and it would have been a time for you to have asked your questions on your issues, on many other issues. But Chair, given the nature of the proposal here, I think I agree this proposal is it's a massive proposal, and I do believe that this one should be maybe another motion for council, because I'm not across all the detail in it. Or neither is my colleague, Alderman Kerrigan. And look, we will be abstaining if it goes to a vote on it because of those issues, Chair. Thank you.
Thanking you, Morris. Councillor Harkin, Sean?
Yeah, Chair, I'll be very brief, thanks. Look, this isn't, in my opinion, a substantial motion. This is basically a request for information from 4 bodies or 4 entities that it's public knowledge they have some role in this, and it's not. There's not a debate whether or not there was a crackdown. So, if it was a substantial motion, there would be a lot more content to it. There is a request, as Councillor Tierney said, to write 4 letters to different 4 different entities, asking them questions, and then people can learn from that based on what we hear back, and they can make up their mind about if further action needs to be taken. Thank you, Chair.
Thanking you, Councillor Harkin. Of Alderman Guy and Councillor Ferguson, but if I could just say maybe, and not to cut across your 2 cells, but the proposal has come in terms of and people are congratulating Morris in terms of being chair of the PCSP for next year. Can I take it that's proposed and second and accepted? Okay, and just to say before I bring Alderman Guy in, that the proposal is put by Councillor Harkin will be taken after the remaining speakers have spoke. Alderman Guy. Darren.
Thanks, Chair, for letting me in. I don't know if I'm cutting out or not. My Wi-Fi's been awful all day.
It's okay now. You're
Look,
okay.
just as the previous speakers have said, thanks, Chair. Just as the previous speakers have said that we held discussions within the PCSP meetings, and the independent members were a bit taken aback and felt left out. And that is why I think it was Councillor Duffy had put forward the plan that we take it into a public meeting, which I think would be welcome within the city and district. Look, the police know they have an open door policy. If you just pick up the phone if you have a problem, and they will talk to you or they will get back to you on it. But look, in regards to Councillor Harkin's motion, PSNI have been involved in the training of many police forces around the world, and I'm sure there would be no issues to be found in any of the involvement with the PSNI in training the Omani police. And I'm sure the shocking scenes that we witnessed on our TV screens at the time when there was a crackdown on protesters, I'm sure the PSNI will be found clear of any wrongdoing in that there. So I will be abstaining from the vote, but I think I would like to have known more about it, but I'll be abstaining. Thank you, Chair.
Thank you, Darren. Councillor Ferguson, Rachel.
Thank you, Chair, and I think it's district-wide with the internet. If I cut out, apologies. Similar to other councillors and aldermen, I do have a good relationship with the PSNI, and I'm feeling I'm able to approach them whenever I have issues to raise. And I also think that there is mechanisms in place and procedures in place that I can go to if that doesn't resolve my problems. I know that there is flaws, and that's why, like Councillor Tierney said, it's not limited to those. So I think there is other mechanisms in which we can use. I am going to vote for the proposal here today because I believe in open and transparency and making sure that everybody can see the details and who is responsible and who knows anything about issues going on within our police force. But I do think I would have appreciated a wee bit more time to kind of find out more, like other councillors have expressed. I'm not over the entire detail, but in the light of being open and transparent, I'm more than happy to support the proposal. Thank you.
Thank you, Rachel. Councillor Doyle, Emmett.
Chair, much appreciated for letting me come on again on this item. I'm a bit concerned about some of the comments that have been made, Chair, in all seriousness around, we can have open meetings of the PCSP. The PCSP could always have done that, and I recognise that the reason why it hasn't been done is because of COVID. But this is a body of people who represent constituencies and DEAs in this city, and I think we played ball with the PSNI district commander by asking him to come on. We know the circumstances. He pulled out at the last minute. Frankly, if it had been somebody from the fire service or from the ambulance service, all of which are public servants, I would have been less annoyed about it because I don't think they have the same agendas that the PSNI does. But just a reminder that we didn't ask, we demanded, and we all agreed to that. Well, the majority agreed to it at full council. So we can't just say now, because it sounds to me like certain parties are maybe backtracking a bit and saying, oh, well, now independent members of the PCSP have their nose out of joint. That's fine. There's no issue with that. But this council made a determination, and it's important for public confidence that the chief superintendent come to this council because we've given the opportunity for him to do it before, and he frankly put two fingers up, and that's not acceptable. So just want to have that noted, Chair. Thank you very much.
Thank you. Councillor Duffy, Sandra.
you, Chair, and I would just like to put on record there is nobody rolling back from any position that we had had. I'm still of that opinion. I was feeding back the information that we received at the PCSP, and anyone who was at that meeting would be able to relay to you the anger that there was from the independent PCSP members. I'm just relaying that. I am still content with the position that we took, and I still am looking forward to seeing the area commander come before council.
Thank you, Sandra. Councillor Tierney, Brian.
Chair, thank you for allowing me back in. But I think it's important just to put on the line from our perspective. Not like Councillor Duffy, we are not rolling back from any position either. As people will know, spoke to the district commander whenever he made me aware that he was pulling out of that meeting, and made him very aware of my thoughts and feelings around that. We would still like to see the district commander come and address council, but I still want to point out, whilst I appreciate the hurt and the anger, as Councillor Duffy has put it, around the independent members of the PCSP, it should, whether or not the district commander comes to this council, it should not stand in the way of independent members of the PCSP and the PCSP as a whole holding the district commander to account for tactics that have been used across his district. That those two issues, and I think it's important to be very, very clear, should run in tandem. It shouldn't prevent one or the other asking questions of the district commander. And I and the SDLP certainly did not intend to cause any anger or hurt to the independent members of the PCSP. I understand and have been a member of the PCSP previously, and understand the difficult role that their members play within their community. And they're the people who, when it was difficult, they joined the PCSP, put their head above the parapet, so to speak, and stood up and said that they were going to come on board to make sure that their communities were represented. And I think they should be commended for doing that. It was never, certainly not mine or the SDLP's intention to cause anger or hurt, but it was our intention to make sure and to invite the district commander before this council to address issues that all councillors from all parties and independents had raised at this council. And I think it's important that that meeting still takes place, Chair. Thank you.
Thanking you, Brian. Folks, as I was saying, the decision in terms of Alderman Devaney Morris being the next chair of the PCSP has been decided on, and that's passed. Congratulations, Morris, and best wishes. I now move to ask Karen to take the vote on the proposal as put forward by Councillor Harkin.
Chair, can I just clarify who the seconder is? I know a number of people said they were happy to, but can we just confirm that for the record?
Is that, Karen, is that in relation to the proposal in terms of Morris?
No,
the proposal in terms of Councillor Harkins?
I'm happy to second that, Councillor Duffy.
Okay, thank you.
Okay, thank you.
Yeah, okay.
Okay, Karen.
Karen, you're on mute, I think.
Sorry. I was wondering, I was getting a reaction there. So sorry, Alderman Devaney.
In Chair, or Karen?
Against, yeah. Alderman Guy.
Abstain, Karen.
And just to clarify, I said abstain.
Sorry, I apologise. I didn't hear that properly. Alderman Corrigan.
Abstain, Karen. Thank you.
Councillor Boyle.
Karen?
Is that 4, Michaela?
Yeah, 4, Karen, yes.
Okay. Councillor Burke.
4.
Councillor Carr.
4, Karen.
Councillor Duffy. 4. Councillor Edwards. Councillor Farrell.
4.
Councillor Ferguson.
4, Karen.
Councillor Fleming.
4, Karen.
Councillor Harkin. Councillor Harkin. I can't hear you. I'll just come
4.
back. Sorry, 4. Okay. That's okay. Thank you. Councillor Sonoya Barr.
4, Karen.
And Councillor Tierney.
4, Karen.
Okay, thank you, members. So, members, I make that 11, 4 and 3 abstentions.
Thanking you, Karen. Thanking you, members. Members, can we move on to the next item, which is the update report on the community and voluntary sector recognition, workers and volunteers.
That's me, Chair. It's Barry again. Sorry, apologies, Chair, for that.
Oh, but Barry, not a problem.
That's it's not the first time it's happened. So like apologies.
No, you're okay.
The report, members, is to seek your approval for the proposed plans for recognition of the community and voluntary sector workers and the volunteers and an allocation of £10,000 for implementation of the same. Members, this relates to the motion agreed in February of this year. Officers from the community development team have met with the market and communications team to explore possible ways to recognise this and for all the work carried out. It's proposed that a recognition and thank you campaign should be delivered over a 6-month period, starting in June 21 during Volunteers Week and culminating in a proposed formal recognition event to be hosted in November 2021. Members, this will obviously be subject to the government guidelines and restrictions in place at the time, and health and safety risk assessments will determine if a formal indoor event will be permissible. Officers will continue to monitor the situation with regards to the scheduling of a formal recognition event to be planned in November. So members, there's no budget at present approved for the allocation around this motion, and it'll have to come in under savings for this year. So the budget will be required from in-year savings, and the recommendation, members, is that you approve the proposal as outlined and an allocation of 10,000 for implementation subject to budget availability from in-year savings. Thanks, Chair.
Thanking you, Barry, and could I ask Councillor Tierney, Brian?
Thank you. Supported the motion whenever it was going through council, and I've absolutely no problem supporting this recommendation either, and proposing it, Chair. If you need a proposal, I think we all know, have all seen via social media and in our own communities the work that is going on by the community and voluntary sector in this city and district throughout the COVID-19 pandemic, and it has been absolutely phenomenal. I was involved in a very, very small way within my own community, and they witnessed the volunteers that stepped up day after day to do whatever job needed done. There was no individual role for anyone. It was just all hands on deck to get the stuff done. We've seen that the government sent down food parcels and food boxes and all of that, but without the volunteers in the community and voluntary sector, it wouldn't have got off the lorry. Not one person would have got it without the help and the diligence of the community and voluntary sector. So I think it's only fitting that we do acknowledge the work that they've done. Yesterday I spoke at the E&R committee and thanked all of the workers within councils, frontline services who played a role in making sure that our city and district was able to they survive and get through the pandemic. I think it's only equally important that we acknowledge the role of others outside of this organisation who also played a role and made sure that those who were shielding or considered the most vulnerable within our community were looked after and were able to shield in the knowledge that there were people out there within their own communities that were doing their best to try and look after them. And I think it's important that we acknowledge that as a council body, but also as elected representatives. So, Chair, I'm happy to propose the recommendation as is outlined by Barry. Thank you.
Thanking you, Brian. Councillor Burke, Tina.
Thanks, Chair. I suppose I should declare an interest in employee of the community and voluntary sector, but just a few points there. It's kind of in the same vein as Brian there. This is obviously a report on the back of the motion that I brought forward back in February. And as I said back then, the intention was to recognise the work of the entire sector, whose contribution, no matter how big or small, is to be commended. I was lucky enough and proud to have witnessed firsthand the role the sector played in what was a very unhopeful and dark time. Just seeing the numbers of volunteers, the workers, neighbours, like so many other key workers putting themselves forward, for me was just sort of a true representation of what on the ground community development is. Communities basically looking after communities, and against the many challenges and the times of the risks, the health risks to people, they went out week in and week out and ensure the most vulnerable were protected. As Brian has said, the sector rallied together and with the forefront in terms of providing the vital support to those isolating or shielding. And then obviously the social elements, from the on-street exercises to the street bangles between neighbours, which was just amazing to watch and see it all play out on social media. And as a council, we should recognise that contribution, and the suggestions which the officers have obviously brought forward would be a good token of appreciation. Just thanks to all involved, and thanks to Chair for letting me on.
Thanking you, Tina. Alderman Devaney, Morris.
Thank you, Chair. And look, I have no problem in supporting the recommendation. I think it's very, very timely. And I would like to put on my party's thanks to all of those people, the community and voluntary sector, who did deliver the help to the most vulnerable over this last year or more during the COVID pandemic. And, you know, they've done a very, very valuable job. And Chair, a lot of the work that went on through this last year, only for the community and voluntary sector, we would have never got the help that was sent on to us, to council, and should it be food parcels or whatever it might be, we would have never got that out on the ground without the help of the community and voluntary sector. And Chair, no problem in supporting the recommendation.
Thanking you, Morris. Councillor Harkin, Sean.
Thank you, Chair. Well, and there's no doubt that workers in the community and voluntary sector should be acknowledged, recognised, thanked for their work over the last year and a half. And I think council officers obviously had a motion to work through and try to figure out how to put together a plan with. And I've actually talked to quite a few workers in the community sector about this motion. And I think sometimes there's a bit of confusion about the community and voluntary sector, right? The volunteering means that you're working for free, or this is something you do because you want to help people, and there's lots of that. And there was definitely people who volunteered, thankfully, through the pandemic to make sure people who were vulnerable weren't left abandoned and isolated by themselves. And there was a lot of community sector workers as well who were on the front line when it was when there was a risk to their own health and to their families. But the community and voluntary sectors, people probably know, is tens of thousands of workers. I know in the Unison community branch, they have thousands of members who all work a job and are paid. And unfortunately, they're paid very, very low salaries. In some cases, they haven't had a pay raise in over a decade. So while this is a token, I think it was described, of our appreciation, it falls well short of what needs to happen. There needs to be a full review, in my opinion, of pay terms and conditions for community sector workers. Their wages have not risen with inflation, and this is a serious problem, and there's no plans to actually formally recognise in a real way and reward them for their actual contribution. So I think we should see this as, I mean, look, people get very frustrated about Boris Johnson clapping people and then telling the nurses, you're getting 1%, right? That was a disgrace. There has to be more done than billboards going up thanking workers, right? And that the motions that we've passed have actually said that we want a £500 recognition payment for workers in the community and voluntary sector, that we want to see significant pay increases for workers in the community and voluntary sector. And it's actually within Stormont's gift that now to devolve powers to change minimum wage rates and bring in real living wages, which would have a massive impact on workers in the community sector, where we have some of the lowest wages. So, you know, that's what I've been hearing back from people. While they want to be recognised, and this is an effort to do that, there is so much more, and we can't be resting on our laurels thinking that this is going to be enough, and that people are going to think that this is going to be enough for the work that they did over the last year and a half and before it, and that they continue to do now going forward as we try to build out of this you know, awful pandemic that we've lived through. Thank you.
Thank you, Sean. Councillor Ferguson. Rachel?
You, Chair, and I'm not sure if it was seconded, but if it wasn't, I'm happy to second the proposal. I think it's a small gesture to show our appreciation to the community and voluntary sector. I must declare an interest working in the community group myself. I think that there was definitely a lot of people who came out and really did take up the hard work and made sure that everybody was connected, everybody was fed, and everybody was looked after. I was speaking with one of the community groups recently who told me that they had a core group of teenagers on weekly, bringing some of their older residents, and to the point that one of the ladies turned 80, and one of the young girls chatting to her wanted to send flowers to her house because she'd made a real friendship. And another girl was chatting with an older gentleman who was teaching her how to train her dog over the phone. And I think these are the kind of stories that we want to show and let people know about, that, you know, everyone really stepped up and everyone really looked after each other, and the communities came together. And if it hadn't have been for these community and voluntary workers, nothing would have been done. You know, people would have been left alone and isolated. So where I appreciate that it is a very small gesture and there needs to be work to be done in the sector and wages need to be improved, I also think it's something as a council we're trying to recognise them, and I appreciate that. So I welcome the report. Thank you.
Thanking you, Rachel. Councillor Tierney. Brian?
Chair, thank you, and I appreciate you allowing me back on. Chair, I don't know whether you're aware or not, but there was a lot of interest in our last full council meeting from the community and voluntary sector right across the city and district, and I spoke to a number of community workers this morning who were quite annoyed at some of the comments that went through that meeting, and the widespread reports of nepotism, poor governance and recruitment procedures within the community and voluntary sector. They believe call the whole sector and they question. I genuinely hope, Chairman, that there's an interest in on this meeting from the community and voluntary sector, and they can see exactly what this council think of the work that they were involved in. And I'm glad to hear all of the comments from all of the councillors tonight, and I hope that these comments are also spread right across to the community and voluntary sector, because I think it's important that all of the community and voluntary sector hear what we think, and not what some people might do to grab a headline in the local media. Thank you.
Thanking you, Brian. And thanks, Brian. I see a declaration of interest from Morris, Alderman Devaney, in terms of, and I think in that sense as well too, a member of the Faughan Community Planning Partnership. Councillor Harkin. Sean?
Thanks, Chair, for letting me in. Yeah, look, I feel like I have to respond to Councillor Tierney's comments there. That's a motion that I believe he voted for at that meeting. So coming in now criticising it, what's going on there? If you oppose the motion, why didn't you vote against it? Because I've actually talked to lots of community workers who are in full agreement with that motion and want to see it in, and we're shocked that anybody would vote against an audit of governance, of pay in the sector, that encourages trade union recognition. So I think maybe you're talking to the wrong people, because thousands of community workers right now don't feel like they're properly recognised, don't feel like they're appreciated, and feel like they're not being, and that's reflected in their pay terms and conditions. So, this discussion is going to continue on, but talking to a few people that run some organisations is not the sector, right? And that's very, very clear. So you voted for the motion. It's now the council's position. So, I don't understand now why you're coming in and trying to criticise it.
Thanking you, Sean. Councillor Tierney, Brian.
Chair, thank you for allowing me the opportunity to respond. And I don't want to see this particular good paper and good report turning into a tit for tat between myself and Councillor Harkin. But I am happy to explain, Chairman, why I voted for that motion. I voted for that motion because I wanted to make sure, and I know that there will be nothing whenever this comes out hanging over the community and voluntary sector in my own DA. I am quite confident of that. And that's why I voted for it, because I wanted to make sure that further on down the road that no one could insinuate that there may be nepotism and poor governance and widespread this, that, and the other. I wanted to give proof that the community and voluntary sector, who I work with on a day and daily basis, and when I said that I was talking to people, I'm talking to people who have worked in the community and voluntary sector for 20 and 30 years, who have dedicated their life to helping their own community. They are the right people to talk to, in my opinion, people with on-the-ground experience. And I can tell you now that they were hurt and annoyed by some of the comments that members in that particular meeting expressed at that time. And that the reason that I voted for it is because I don't want them people working any longer with anything hanging over their heads. I have no doubt that the community and voluntary sector, and particularly in my own area, which is where I have probably the most experience with the community and voluntary sector, will come out with a clean bill of health, and I look forward to it. And I hope at that time that people will reflect on their comments. Chair, thank you.
Thanking you, Brian. And sorry, just to note another declaration of interest as well in terms of Alderman Hussey. Thank you, Derek. Councillor Duffy, Sandra.
Thank you, Chair. That was an entertaining exchange there. But just on the motion that was passed, I suppose a question to you, Karen. Are we any further forward in how that is actually going to be taken forward? Because it is a massive piece of work. It is going to be at a considerable cost, I would imagine, to the council and in turn then to the ratepayer. So I'm just wondering how the outworkings of that is going to look, and have you given it any thought? I suppose one of the comments I've had from my conversations with people that work in the community and voluntary sector, don't think I've talked to thousands now, that would probably be a bit of an exaggeration, but some of the comments that they have made is that they are one of the most regulated and the most audited of all sectors in our community at the minute. So they're open for it because they know they've nothing to hide. But I just know it's a really extensive piece of work. So, Karen, have you given it any thought, consideration? Thank you.
Chair members, the issue of the motion and the process that's been taken in through internally, it's been laid up by the lead audit and assurance officer, and my understanding is there's an intention to report back to the audit committee on the scope and the issues that are identified for members to consider.
Thanking you, Karen. Councillor Doyle, Emmett.
Thank you, Chair, for letting me in. And I suppose it goes back to the more recent comments. I as well saw a particular statement, I think it was from the Northwest Community Network, unless someone can correct me, expressing concern about the motion that we passed, and I voted for it, and I would vote for it again. I spoke to the I believe the director of Northwest Community Network to outline from Intu's position that the voluntary and community sector in this city is second to none. They do things that this council could never do. And they come up with ideas to problems that governments could never fix. And they're to be applauded for that. But where there are concerns, and I do have some, as I'm sure other members may well have, where there is the impetus to look at some issues that have been reported, across even the last number of meetings that we've spoken about in relation to some specific areas, then we should do that. But this motion in particular, like Brian said, in fairness, sends out the right message. We are very much in debt and have been for many years and will be for many years to the community and voluntary sector, particularly over COVID, but long before it. And I just want to put that on record. Thank you, Chair.
Thanking you, Emmett. Folks, I don't have any further speakers. The report and the recommendations has been proposed and seconded, and I think in the main has been welcomed. So unless I hear any anybody looking to vote against it, and I'll give a brief period for that, then the report will be carried. Okay, folks, moving on to the next item, rural priority report in terms of the action plans for Strabane, Derry and Faughan. Again, Barry.
Thanks, Chair. Members, the purpose of this report is to update you on the findings from a recent report carried out by Fern Consulting on the 3 rural DAs, including proposed priority actions emanating from the research and the consultation carried out. Members, you'll be aware that the local growth partnership boards in the Strabane, Derry and Faughan DAs are made up of local community reps, council officer representation and elected members. These structures have been invaluable over the past year, in particular in the coordinated emergency community response to the COVID pandemic. The work of these 3 partnerships can't be underestimated, particularly in the last 15 months. The joint partnership work and dedication and commitment to their communities has highlighted how joined up working between community, residents, elected reps, statutory agencies can work effectively together to receive results. Members, in terms of this particular piece of work, within the 3 rural DAs, you'd be aware there's no comparable structure. The impact across the same, the DAs around investment and infrastructure has been problematic in recent years. In order to develop and build on the local community planning structures within each of the areas, DFC and DERA agreed to form a pilot study that focused particularly in those 3 areas. This piece of research was carried out by Fern Consulting, and it involved all 3 partnerships. You'll see, members, in section 2.5 the key objectives of the research, and you'll see details in your appendices. With regards to key issues, the individual priority actions have been developed for each of the 3 DAs, and there's 6 to 7 key priority actions. The top 3 priority actions across all DAs are: 1, increased access to broadband; 2, investment in dedicated community development human resources; and 3, provision of additional and adequate youth services. The level 2 priority actions across all 3 DAs is the development and delivery of a rural education programme, and level 3 priority actions were specific to each DA. Within the Faughan DA, the top priority action under level 3 was family support. Within Strabane, the top priority action under level 3 was rural transport needs, and within Derg, the top 3 level priority was local community facility audit. So members, I'm not going to go into a whole pile more detail on it, but the report again has highlighted the stark underinvestment in the rural DAs in comparison to urban DAs. So at this stage, there's no financial implications within the report, and in terms of a recommendation, you'll see that members endorse the rural priority action plan and the associated findings. Thanks, Chair.
Thanking you, Barry. And there's a couple of indications of interest in terms of members of the local community partnerships, which obviously myself would declare as well in regards to the Faughan. In terms of those who have indicated to speak, if I could ask first, is Alderman Devaney Morris.
Thank you, Chair, for allowing me in, and I did declare an interest on the Strabane group earlier on. I have to say, Chair, I fully support the recommendation coming forward here, and I'm delighted to propose and endorse the recommendation in its entirety. And I have to say, when we always talk about the neighbourhood renewal, and we talked about it earlier on the disparity within the rural DEAs. I have to say this goes some way in bridging that gap there, and it is very, very welcome. And when you look at the issues, the rural needs that are out there, I think it's fairly evident. You know, the first three there that are on increased access to broadband, I think that's easy one. The second one is probably the most important one as well, as a very important one, is the investment in dedicated community development human resources. That is an issue that I'm sure all of the local growth partnership boards would echo. And provision of additional and adequate youth services would be another vitally important one. But Chair, I'm not going to keep you all night, but I have no problem, as I said, in proposing and recommending the endorsement of this recommendation. Thanks, Chair.
Thank you, Maurice. Councillor Ferguson, Rachel.
Thank you, Chair, and I'm happy to second the proposal. These were some of the last meetings I got to go to in person before we went into lockdown, and I must say, I understand the priority one being the rural broadband, but I think especially in declaring interest in the fucking board here, but the biggest ones for us was the youth provisions and the resources, like Alderman Devaney had said. The lack of actual programs, and we addressed this with the neighbourhood partnership before, within the rural areas, was from looking over the report, is across all three DEAs. Statutory bodies not coming in, maybe just providing a facility and not necessarily a program to run in those facilities, and that leads on to the resources. When you're talking about resources, what we're talking about again is that the majority of community groups in the rural area are running on volunteers and not paid staff members or project managers or people who are able to try and find funding for them. So there needs to be an increase in that in the rural areas. I was very proud that we did look at that with our community care packs, and we increased funding towards the rural areas so that they could have someone oversee their areas with the likes of food parcels and the vouchers. So I welcome this report, and I'm glad that it is across all three DAs you see a similar response, because I think that will be stronger when coming back to the departments on what is needed in our rural areas. Thank you, Chair.
Thank you, Rachel. Councillor Boyle, Michaela.
Thank you, Chair. No, it's just briefly just to make a comment to endorse the rural priority plan that we have before us. And I suppose just in terms of other speakers, just to echo what they have said, I think just in terms, I want to just highlight the fact that the voluntary contribution that key workers in our rural areas have made, particularly during COVID, and the work that they did within their own areas. They done it without being prompted, obviously. They took to the mantle, and I suppose used the opportunity as a way of gauging what the needs are within our community as well too. This report does identify a lot and highlight a lot of things needed for the rural areas, and obviously the development of the rural area. So I want to endorse the plan, and I commend everybody involved, and particularly all the stakeholders as well. Thank you, Chair.
Thank you, Michaela. Councillor Edwards, Stephen.
Equally, I won't keep you long, and fully endorse this report on behalf of the SCLP and the priorities outlined there, the top three priorities. I hope Project Strabane can deal with number one, the decent degree, and definitely agree with number 2 and 3, youth services, and have more people on the ground in the community within the rural areas. And I also just want to say that I'm part of, and I declared interest as a member of the Derry Local Community Growth Partnership Board. The response of the rural lives has been immense over the pandemic. And I just want to put on record my thanks. I know, especially from the Derry and Strabane boards, the work that people's done, a lot of it voluntarily over the pandemic, has been second to none. So I just want to put that on record. Thank you, Chair.
Thanking you, Stephen. And I don't have a proposer and seconder. I don't have any more speakers. And just given the content and the work in terms of the three reports and those who have spoke to them, I wouldn't surmise there's anybody speaking against. So propose and second it, and if people are in agreement, we can sign off on it. Thanking you. Members, and you used to guide me a wee bit in this. I was thinking or proposing maybe to take a 10-minute break. 10 minutes, maybe come back at 20:09. I know it's a wee bit more than 10.
Agreed, Chair.
Is that okay? Because there might be a couple of things in open for information that people might want to talk about, and advice services may or may not last a bit. So maybe now's our last chance to take a 10-minute cup of tea or whatever, smoke. 20:09, folks.
Happy enough, Chair. Thank you.
Okay, Gormai. Hello, folks. Can we restart again? Are we okay?
Yeah, I think from an officer's perspective, we're okay anyway, so.
Okay. If we could move, folks, to the item on advice services funding, and if Barry could take us through it, please.
Yeah, thank you, Chair. Members, the purpose of this report is to seek your approval on allocations of funding to advice providers for the delivery of generalist advice for the remainder of this financial year and consider the implications arising from the committee resolution regarding funding requirements. Secondly, to seek members' approval to extend the pilot tribunals appeals programme for a further year until March 2022. To seek members' approval to extend the welfare reform mitigations extension face-to-face advice programme until March 22. Members consider the recommendations of the advice panel in respect of a proposed areas of improvement within the commissioning process, and members agree to write to DFC to lobby for additional funding towards advice services. Members will be aware that Council provide financial support for the provision of generalist advice services with 3 key providers: Advice Northwest, Dove House and Resource Centre. Interim allocations for a 3-month period until June the 30th, 2021 were approved through the extension of funding contracts. Arising from the committee resolution, Council acknowledges there's been a significant cut to the funding of the existing providers in both real and inflationary terms since 2015. Therefore, Council agrees it will not pass on any further cuts to advice providers. Additional consideration be given to the funding implications for contract holders. Subsequent council motions members have been resolved in relation to issues and concerns expressed by members about the community and voluntary sector funding, and these are being addressed by the head of audit as has been communicated to members. And members will be aware that council policy and the allocation of funding to advice services utilises statistics from the providers' recording systems, and following recent changes to that process, the commission agreements for the financial years 1920 and 2021 were extended based on statistical information for the 18-19 year to ensure continuity and reliability following the system changes from Karma, the old Karma system, to Advice Pro. Officers have been engaged with Advice NI and Williamson Consulting to ensure the availability of data from March 2020 to March 2021, and this is now available and has been utilised to generate the prospective funding awards. Members, you'll see in section 3.4 the overall approved allocation from rates monies and DFC funding. There are further indications of additional funding in response to COVID to continue to directly support grassroots organisations' response to the pandemic, and these will be reported on separately by councils as specific COVID support. The community development and advice funding is allocated by council to each DEA using a formula which considers population, deprivation and rurality, and the analysis is done using super output or ward-based data before being collated on a DEA basis. Providers receive a percentage of the funding for each DEA based on their actual output in each. This is to ensure that the funding follows the client, to ensure best value in the delivery of advice services, and to meet the recommendations of Council's internal audit. The advice panel has considered 3 options outlined at a presentation by Williamson Consulting and subsequently met again to consider these options in further detail. The options outlined in Appendix 1 were considered in terms of their ability to fulfil the requirement of the committee resolution, affordability, additionality, sustainability and overall funding commitments of council and potential rates impact. Members expressed views in relation to the historically used allocation formula and agreed that further actions to include a review of commissioning agreements, undertaking a quality audit across all contract holders, and engaging with the advice panel members to agree the terms of reference for the same. Assessing the recording processes operated by each provider and lobbying DFC to provide additional advice funding support to avoid placing the costs on ratepayers. On the basis of the above additional actions being taken forward as an agreed programme of works, the preferred option included in Appendix 1 was deemed the most viable option at present. In addition to the approved £705,292, an additional requirement of £27,519 will be required. And so, members, in terms of the financial implications, you'll see that further £27,519 is required in order to provide funding in line with the committee resolution, and this would be required to be sourced from in-year savings. Additional expenditure beyond this level would pose a challenge in the absence of quarterly return outputs indicating the availability of surplus funds. So members, you will see in terms of sections 4 around the welfare reform medications, £112,300 has been secured from DFC and requires no match fund from Council. Council also have received confirmation from DFC on the total funding, and that includes risk funding and additional 38,400 towards tribunals, appeals, representation and support. And a deficit of 30,000 has been identified from underspend within the community services budget to continue the tribunal appeals in year. So members, in terms of the recommendation, you'll see in section 5.1 with the additional 27,519 budget that Advice Northwest would receive 529,174, Dove House 143,526, the Resource Centre 60,111. Second recommendation is that members approve the extension of the Tribunals Appeal programme for 1 year, with the allocations listed: Advice Northwest 45,540, Dove House 30,359, and the Resource Centre 15,179, and that members approve the allocation of welfare reform mitigations extension face-to-face advice funding for Advice Northwest 52,772, Resource Centre 29,764, and Dove House 29,764. The final two recommendations, that members consider the recommendations of the advice panel in respect of the proposed areas of improvement within the commissioning process, and that members agree to write to DFC to lobby for additional funding towards advice services. Thank you, Chair.
Thanking you, Barry, for the report and obviously the work involved. And I have a number of speakers in this, and if we could start off with Councillor Farrell, Rory.
Thank you, Chair, and thank you, Barry, for the paper. Obviously, this has been discussed at length at the Advice Services panel and in various committees reaching back in March. We met last week and there was broad consensus on the preferred option, but it wasn't unanimous. In fact, I made the proposal at the working group that we accept the preferred option. Whilst imperfect, it was the least worst option. I have since reflected on my proposal and I have a slightly different view on it, and I am bracing myself for the inevitable criticism, but I'll take it in the chin. There's a lot to welcome in the paper. You know, we're extending the welfare mitigations programme, we're extending the tribunal appeals pilot, we're committing to review the commissioning agreement and to conduct a quality audit. And we're asking the Communities Minister for more money to fund our advice services providers. But unfortunately, I'm not in a position to propose item 5.1, which is the allocations to the advice providers. As everybody knows, the annual funding for the providers is based on the previous year's output. It's evidence-based. And that's a right and proper approach. You know, our argument for enhanced detox services in Derry is based on evidence. Our argument for enhanced university provision in Derry is based on evidence. And our argument for increased job creation funding is based on evidence as well. And I would note that when the advice panel originally convened in February to review the recommendations from the consultant, the evidence was based on 9 months output from the service providers. Now we have 12 months data and the allocations have differed. When we met at the panel, we met the advice providers and there were differing views on what was called substantial advice. My view and our view is that the quality audit that is included in the proposal needs to be carried out. specifically regarding the recording processes. We need to be confident that there's uniformity and conformity across all the providers, because we need to have confidence in this decision, and we need to have confidence in the data that's used to make this decision. So I'm making a proposal. I am proposing that we extend the current funding arrangement for a further 3 months to allow the quality audit to be conducted, and then the result of the quality audit is used to inform the funding allocation for this year. And I know that this is going to be frustrating for our heroic advice providers. They need clarity on this funding, and they need it now. And I am also acutely aware that the outcome of this audit is currently unknown, and obviously that could present a further financial liability for this council. But I feel it's important to get this right. And before I put the proposal formally in the chat box, and before I ask for a seconder, I would welcome the opinion of the director in terms of, would it be realistic to get the audit done and have formal recommendations coming from the audit within 3 months?
Chair, it's not something I suppose we've considered in detail in terms of the timing of it. Obviously, that was the recommendation from our previous discussions. If that's the view and intent of committee tonight, we would absolutely action that and try to move it forward within the timeline. So I don't know whether, Barry, you want to comment any further on that, just in terms of the processing of the sort of procurement of that particular service, but certainly if we can achieve it, we will do.
Yeah, through yourself, Chair, and in response, Karen. Yeah, look, we would, if this was the will of committee, we would do it as expediently as possible. But there is the issue of procurement. We don't have a consultant on the list. We would, while there's not a lot of providers, we'd still have to go through public procurement and the relevant timescales, and then there is quite a considerable amount of work and gathering information around that. So we would try our best to have a report back within 3 months, but a lot of it would depend on procurement and availability of the required consultants to do that work. So we would try, but we couldn't make that guarantee that it would be done in 3 months. Thanks, Chair.
Well, can I come back on just slightly? Well, just very, very briefly, Chair, and thanks. Thanks to Barry and thanks to Karen for that feedback. I'm happy enough that, the officers will try to get this done as soon as possible. So I'm going to just put the proposal in the chat box, if that's okay, Chair.
Okay. As you're doing that, sorry?
Very brief.
No, as you're doing that, Rory, I'm going to, because there's a number of other speakers, and I have speakers in the line of Councillor Doyle, Councillor Duffy, Councillor Harkin, and Councillor Samoy Barr. So, Emmett.
Thank you, Chair. And Councillor Farrell was right. And what he expected was going to come from his turnaround today, because I'm sure Councillor Harkin will say exactly what I know he's going to say, but he was the one that berated us all that we had to make a decision at the advice panel. Now, it's folly for a start. And why is it folly? It's folly because we've been told time and time again that quality audit's going to take a number of months, and I don't think 3 months is long enough, frankly, because we don't want a small audit, which is a point I made at advice panel. It has to be a comprehensive audit, and that's why I secured the amendments to the recommendations at the advice panel. 2, we can't make cuts in year. So even if an audit came back after 3 months and recommended cuts, they wouldn't be until the next year anyway. And we've been told that time and time again. So the the recommendation that came from the advice panel was done, I have to say, from my perspective, through biting my tongue, because I am not convinced that the data that we are making the decisions on is robust. But we have looked at every other possible way in which we could keep people in jobs, which is primarily where this funding comes from and goes to provide those services, whilst at the same time trying to fix the system, which I've been saying for a long time is an absolute mess. And as far as I can see, and have said at the advice panel, the formula doesn't work. And that's evident in the fact that we're all about to agree that the whole system is going to be rehashed. So, I mean, I would like to hear a number of things first, because I have a number of questions just on some issues that have come up. And maybe I'm sure Barry and Karen will be able to answer them. Primarily, where does the how did we work out the figures with regard to the tribunal's appeals program? Because I don't remember that being discussed at the advice panel, especially at the last meeting. So I'd be interested to hear that, because I know, for example, and I put it in the chat box earlier, as a member of the board of RCD, we've got a part-time member of staff down there, and there's a backlog of 70 cases at the minute, and we need more resource, and I'm sure that's right across the three providers with regard to tribunals and appeals. In terms of a confirmation of what I've said, in terms of we can't make cuts. Sorry, Chair, were you going to say something there? You were on mute.
See there, but I don't know if
you're back. We lost you for a minute there.
No. Oh, you lost. Right. So did I go in full what Emmett was saying? Sorry, Emmett, I didn't mean to interrupt you.
You're okay, Chair. I wasn't sure whether you were coming on there. So confirmation from the officers that we can't make cuts in year, which is what we've always been told. And in terms of the one other question that I'd like to ask is, with regards to the overall process of gathering the data, previously, of course, we've always used the one provider, I think at Williamson Consulting. When are we going to put that contract out to tender as well? Because I think there's been I've been getting queries about that. But to go back now and suggest that we do this for another 3 months, I'm not content with it. I don't have a vote in this committee, but I'll make that clear at full council, because I don't see how we can now say, after we waited for 12 months to get the correct information, that we now go back and try and do it differently. We have to work on the data that we have, as dodgy, frankly, as I think some of it is. There's no other way around this at this point, and it's people's jobs we're talking about. So I have serious concerns about what Rory has brought forward, and I would say others will have as well, given he was the one that frog marched us up the road to making sure that a decision was made that day. So thank you, Chair.
Thanking you, Emmett. And as I say, I have another number of speakers, and I see a few declarations of interest in there, and just they say as well, the Councillor Farrell, Rory has put in a proposal which still requires a seconder. But my next speaker is Councillor Duffy, Sandra.
Thanks, Paul. Yeah, I'm taking a deep breath. I want to put on record my thanks to Karen, Barry, and everybody that has been working on this, including the advice panel, who have been knocking their heads together probably for a significant amount of months on this, without ever sort of coming to any form of agreement. The last meeting of the advice panel I did attend in Christopher's Place, and reluctantly, very reluctantly, because I was actually in favour of option 2, as I believe option 2 was the option that stayed true to the formula. I know other people had issues with the formula, still have issues with the formula, and maybe bringing forward proposals around that, I don't know. But in my view, option 2 was the one that was the closest to sticking to the formula, which was as a result of the audit team within council and other independent consultants in terms of making sure that the process was fair and equitable to all parties involved. But this proposal now, coming from Councillor Farrell, who, as Councillor Doyle has highlighted, was the one who was pushing in the direction of option 1 at the meeting, very much using the emotional argument around jobs and stability of the advice services, which we all took on board and which we all agreed with. And reluctantly, I agreed that we would go with option 1, even though I still have serious concerns that it's moving away from the formula. I also still have serious concerns that legally it could be challenged because it has moved away from the formula. But this proposal now at this stage, in terms of holding off for another 3 months, which we all know will not be 3 months, because anyone that has been involved in an audit will know that it won't take 3 months, particularly with procurement, particularly as we're in June going into July in the summer months, and we know how things slow down over that period of time. So to think that we're going to postpone this again, it's ridiculous, and we certainly will be supporting that proposal tonight. No, I'm actually flabbergasted that it has been brought forward by somebody who was such a proponent of option 1 at the advice panel. I can't understand it. Thank you.
Thanking you, Sandra. Councillor Harkin, Sean.
Thanks, Chair. Not surprised to see Sinn Féin and the SDLP turning on each other here as they both attempt to cover their tracks. I mean, the context here is that we've praised the advice services sector, advice workers who've bent over backwards through the pandemic to help thousands and thousands of people. But the DFC Sinn Féin minister couldn't guarantee $1.5 million funding for advice services workers, and it had to be campaigned for and fought for to ensure it would be in the budget. And then we had our own council, and again it was Sinn Féin and the SDLP who led the way with a proposal that was going to slash funding for 2 of our advice services, and that's why we're in this situation right now. So that's the context. I think this is a disgrace, and we said this from the start, that like how can we even be thinking about slashing funding right now for people that we're praising up and down. So you know, as people have said, there was an advice services an advice panel meeting, and people were, I think, cajoled into supporting this proposal as the only option. I refuse to endorse it. I think others very reluctantly or with a lot of qualifications went along with it. The issues of 5.2 and 5.3, I'm not sure we even need to be discussing them, because my understanding is that is money that goes directly from the DFC to the advice services. So the key thing that we are dealing with here is proposal number 1. Now, we have passed a motion as a council stopping the council from passing on cuts to our advice services this year, which I think is only right given the work that they've done for us over the last year. Now, the reality is, even with the same funding over the next year, it's still a cut, because if you've got a static amount of money from 2015, every year that you don't increase that with inflation, rising costs, it's a cut. It's the same way if your pay is the same in 2015 and you're getting paid the same in 2021, you've had 6 years of pay cuts. That's the reality. So we haven't rewarded the advice services sector or our advice providers. There's been year-on-year cuts. So this doesn't even do that. Our motion from the council isn't even properly doing that. What it's doing is it's making sure that people don't lose money, even from where they were. So what I would say is, I welcome Councillor Farrell's decision to do a U-turn in this. I don't think that we can do the audit in 3 months. I think we would need to, I would amend your proposal to extend it to 6 months. So that would be my amendment, and I'd be happy to second it if you agree to that. And And here's the problem with the 5.1, that there is a challenge right now to those very stats that are being used. There's an audit happening that Councillor Doyle put through, and that this was something that I have also and others have raised as well. So I think the problem is, a number of us said that we believe that the whole basis that led to the proposed cuts in the first place was very problematic, and that's what's being looked at. And then we're being asked to vote on that basis is very problematic for councillors. So it seems to me that the only way to move forward in this would be to allow for a 6-month review, because I agree with people, it couldn't be done in 3 months.
Thank you, Sean. A couple of things, folks. I have 4 more speakers in this, but Sean, Councillor Harkin has brought forward an amendment. I just think we need to take a minute there, as I say, there's a proposal there, but there's no seconder date. So there's an amendment coming forward, the proposal that isn't seconded. So I don't know if people want to clear that up. Okay. The next speaker is Councillor Seymour Barr. Lillian.
Thank you, Chair, and thank you for allowing me to speak. I was obviously not present in previous meetings, so I am going purely with the information presented to us and my knowledge of the Advice Centre. And I think we can all agree that we have all experience and continue to see dramatic. Somebody hear me there? Hello?
Sorry, Lillian, I'm not sure what happened there. Sorry about that.
Yeah. Okay. Just had people laughing there.
I was
Okay.
say sorry about that. It wasn't me laughing, but I'm sorry somebody laughed, but no.
Okay, that's okay. So as I was saying, I think we have all experienced and continue to see a dramatic increase in the uptake of advice services and support here in the city. And what I like about advice services, the nature in which they operate, it allows that flexibility in response to the pandemic particularly. And this is because of advice centers' connection to places and the credibility that they have among the communities that they serve and support. So the SDLP believes that council should absolutely provide the maximum support needed by these advice centers to continue operating effectively. And there should not be any group disadvantaged or penalized at this critical time. While each advice service has different capacities and capabilities, the pandemic presented enormous challenges to people and communities, and the Advice Centre was not spared of these challenges. And as a community worker, I am very sympathetic in terms of the place where they are working at the moment and the situations that they are in. But unless there is a system put in place to assess the quality and level of support provided to each individual who accesses advice, no group should receive a cut in funding, particularly this time when there are so many within our communities rely on advice to navigate confusing, inconsistent, and hard to understand information produced by our own government here. And others do not simply know where to even start getting that support. So advice services are critical to communities, to our communities here. So I do think we should support Sean's amendment of extension of 6 months to allow groups to continue providing that vital support and currently provide that they're currently providing, and at the same time allow officers to carry out the quality audit and make recommendations that we can consider as a committee. So I would second Sean's proposal.
Okay, Lillian, thanking you. Councillor Ferguson, Rachel.
Thank you, Chair, and I am a member of the working group. I was in favour of both option 1 and option 2, and obviously option 2 would have put a lot of strain on us as a council and our ratepayers. So we did express that option 2 would be the ideal if we could get funding from the department to help support that. I also believe that we were going off the 12-month figures from the previous year, which then meant that some of the groups would end up with a cut, and this money was a one-off to supplement them so that there wasn't any cuts, that they would stay at the original amount that they had the same last year. But in the same vein, that one of the groups that was only getting funding at 80% of their figures was up at 100% of figures. So I did raise the query that this issue will happen again in 12 months' time, because it is a finite budget and it's going to be the same issue in 12 months' time, and said that if we wanted to go away from this model, that we need to look at different options and different formulas, that we need to start using that very soon. I don't think that can be done, and this is coming from, you know, being in this working group for a number of months and seeing how much work has gone into it, and the conversations that's been had. I don't think that can be done in 3 months. I worry that it can't be done in 6 months. That's and I'm wondering, and I want to kind of ask officers, if we do that, if we were to put it in for 6 months, would we end up having to do a back payment in 6 months' time to the groups that have missed out on this proposal? I'm really concerned. I thought we'd come to a solution where nobody was 100% happy about it, but the groups needed the funding, and like other councillors have said, it's jobs, it's people's security. They needed that security for the next 12 months. And then us internally could work in the next 12 months to figure out where the flaws were, to figure out where the issues were, and find a better way going forward for the next 12 months. So before I decide on this one, I'd like to just check with council officers on the implications of doing this, whether or not we can do it, whether or not we'd have to then back pay for anybody that missed out, because there is a group currently with the current formula getting payments due to 80% of the workload rather than 100% of the workload. Thank you.
Okay, Rachel, thank you for that. Does anyone, council officers, want to pick up on that now? It might just inform the rest of the debate or help further inform it.
Sure, I can come in for, I think Councillor Doyle had also asked a couple of questions. With regard, first of all, to Councillor Ferguson's questions, not something I'm entirely sure about. We would need to get the legal opinion from Philip, Rachel, but you know, we do have a commissioning agreement based on delivery last year, and notwithstanding the comments of other members, we're bound by that. So we would need to get a view on Philip, but that's the reason we have commissioning agreements, that we're bound to honour those agreements based on what the council decision was. So we would need to get that double checked with Philip. The other one, with regards to Councillor Doyle, had asked me about tribunals, how we fund that. That was an agreement. That's not funded similar to generalist advice. That's funded for additional staff, and there was an agreement between the three providers. They would get an allocation of staff, half one staff and two staff for the three organisations based on their overall general percentage of allocation in recent years. So that's funding directly to staff for additional tribunals and appeals. I think Councillor Doyle was querying that specific one, so that's how we fund that.
Okay, Barry, thanks for that. I have 5 further speakers, folks. I think it's a couple of people coming back in again, but obviously given the nature and the importance of this. But the next speaker is Alderman Devaney Morris.
Chair, I would like to just hold back. I know Councillor Farrell wants to come back in again, and I just want to see, has he anything to add to the proposal, Chair? If you'd bring me in after Councillor Farrell speaks, because I just want to hear what he has to say.
Okay.
Okay, Chair.
Okay, Morris, I just need to work my way down the list, and if people want to sort of...
Or I can speak now if you
No,
don't
no, you're okay.
Yep.
I'll bring you in after
Yep.
Councillor Farrell speaks, but the next on the list is Councillor Duffy. Sandra.
Thank you, Chair, for allowing me back in, and I know that's an indulgence, so I am grateful. I just felt the need that I needed to comment on some of the stuff that was said there. Some of the commentary from particularly Councillor Harkin was completely disingenuous. Again, I don't know where he lives. Perhaps it's Narnia, but he has a warped narrative around much of this, and what he is actually doing is politicking around the advice services at a critical time. We're in the middle of a pandemic. Everybody in this chamber agreed that there would be no cuts to advice services in the middle of it. So I don't know where he's making up this other nonsense that he's coming out with. In terms of the DFC minister put out her budget for an EQIA assessment and consultation so that people could feed back, so that she would be armed with the evidence to ensure that she could bid for adequate funding, so there would be no cuts to the advice service. That was the very purpose of why she put her budget out for consultation. So, you know, the warpness around this, the politicking around this is really frustrating when it is jobs, when it is services to really vulnerable people during a pandemic, people who are losing their employment, people who are applying for benefits for the first time. And I think, you know, go on, please wise up around some of this stuff. Yes, I recognise that you believe that there is stuff that needs to be corrected, that needs to be looked at, that needs to be reassessed. Let's get on with it and do that. But in the first instance, let's make sure that we don't destabilise a whole sector of our advice services in the middle of a political argument that you're looking to make. Chair, we won't be supporting the proposal in front of us or the amendment, because I think what we need to do now is step up to the mark and stabilise these services and stop creating the uncertainty around it where people aren't sure of whether they're going to have a job tomorrow, 6 months, whatever. Let's get on with it. That's what we're here to do.
Thanking you, Sandra. Councillor Farrell, Rory.
Thanks, Chair, for letting me back on again. I genuinely appreciate it. I just want to comment on some of the remarks. Councillor Doyle said about dodgy data, that, you know, this funding allocation is based on dodgy data. That's why I'm saying let's do the audit now before a final decision is made. And that will hopefully reassure us that the data isn't dodgy. We can make an informed decision and we can make the right decision. Councillor Doyle and Councillor Duffy were mentioned, you know, how vehement I was in relation to the preferred option in the paper. I was, but I've reflected on that, and I didn't know they were that easily influenced. Councillor Duffy also refers to option 2. Option 2 sees £182,000 extra spent on advice services, 64,000 extra for Dove House, and 117,000 extra for Advice Northwest, with not one penny more for the resource centre. I don't think that's fair. In terms of the audit, I think it should be done before we make a final decision. I had said 3-month timescale. I'm happy enough with 6 as well, and that's why I asked the officers, was it achievable? So those are the points I'd like to make. Thank you.
Thank you, Rory. Alderman Devaney Morris.
Thank you, Chair, and thanks for giving me the space there to allow Councillor Farrell to come in. And I just want to put on record, yes, I know when just previous to the Vice Panel meeting, there was a meeting set up, and I heard Councillor Farrell vehemently going for the recommendation this here, but look, quite rightly so, it's up to him, he can change his mind. But I would just be very mindful of some of the language here being used tonight, Chair. Dodgy data and stuff like that, and around that, it sends out a very, very bad message. The problem, Chair, sometimes is when you're calling here, some people are calling for a quality audit. Let's be very sure, sometimes when the quality audit comes back, there could be losers, or there could be a loser. So we just want to be very, very mindful of that. And back to Councillor Harkin again. You know, it's very, very easy for Councillor Harkin to talk about money. He couldn't even support the rates rise when it came to the full council, when it comes to rate. So I give him his due. I will wait until we come to the next rates meeting and when we're in the discussions again and see where he, see what side he votes on them, because in the past He didn't even want a rates rise, and he continually calls about money, but he can't support the rates process, so he can't. But Chair, on the proposal and the amendment here, I know we will be voting against it. Thanks, Chair, because I do believe what the money here, yes, we can argue about is 27 grand, but it's get it on the door of these groups and help them through the pandemic as they move on.
Thank you, Morris. I have two further speakers, folks, Councillor Doyle and Alderman Guy. Emmett.
Thank you, Chair. And again, I'd just want to thank you for letting me on the second time. And not often that I agree with pretty much everything that Sandra said, but I do. What this comes down to is the need to secure people's jobs, and that's why, reluctantly, as we've all heard, we agreed to proposal 1. Now, I did ask as well, and I'll give hopefully Chair, you'll be able to give the opportunity to officers to confirm that we can't make cuts in year, which is effectively what this is telling us to do. I would also point out, though, Chair, that I did raise an eyebrow about the comment with regards to trying to get a legal opinion with regards to changing the commission agreement, because as far as I can remember, and I've checked my notes while I was waiting to speak, we agreed we would do that months ago, and in fact, I was waiting on that. So if it hasn't been done already, someone needs to check up as to why that is. Now, look, see what this comes down to is this is kicking the can down the road. I don't like the fact that we have to continue on with where we are vis-a-vis option 1, and I don't, for a second, regret using the term dodgy data, because that's what I believe it is, and I welcome Morris to the advice panel anytime he likes, because I don't think he's fully informed about why I feel that that's the case. But if we're saying now, let's crystallize the issue. If what we are saying is that the system and the data that comes from it is not fit for purpose, then we can't continue using the same formula, because the formula is only as good as the data that it gets. And not from my mouth or from the mouth of any of the political representatives here, but from the provider's own mouths at advice panel, there was a differentiation in the information that went into the system, and that is where the problem is. So we have to get real about this, and the U-turn tonight, I hear from the members of the committee that they'll not vote for it, and I welcome that, because coming up at the last minute and trying to put a sticking plaster on a massive issue is not good enough. And we've all had plenty of time. There's been months between device panels to gather information about alternatives. It's obvious that that has not been done by some members here today. And I have to say, I welcome that our newest councillor is totally on board with the proposals that I've made all along, that we need to produce outputs that save jobs, that takes into consideration the entire need of the community and not just that underpinned by a mathematical formula, and that the current proposal doesn't stand up to scrutiny. 3 months, whether it be 3 months or 6 months, because again, we can't make cuts in year. So welcome that as well. Thank you, Chair.
Thank you, Emmett. Alderman Guy, Darren.
Thank you, Chair, for letting me in. Look, I at the last panel meeting, I chose the preferred option. Give me, there was last year was a extraordinary year. We don't know if this year is going to be the same. We don't know. We expect it could be worse. We just don't know at the minute. Obviously, Councillor Farrell's brought this proposal forward today, and it is too big to make a decision on it. After listening to Barry, I would propose to defer it to the earliest possible time that we can get another panel meeting, with the advice of our legal services. I don't know what all our members feel like about that, but I just think that if we're looking at extending this again, and the last audit was 4 years ago, so it's like it can't be rushed, a decision like this when this is being thrown in now. So if people are prepared to discuss it further, I'm happy to take it to a panel meeting at the earliest possible did. Thanks, Chair.
Thanking you, Darren, and I have a couple of further speakers, but again, wouldn't be renowned for being panicky, but I do have to mention again, we have a proposal that isn't seconded, and we have an amendment to that proposal that isn't seconded, which is seconded.
Chair, apologies. I'll second Councillor Farrell's proposal. I thought I
Okay.
already did in the chat box, but my apologies.
Okay, okay, Brian. And the reason I was saying that, Brian, because Darren, in all sincerity, is making a point about a deferral, but there's a proposal on the floor, and there's now an amendment on the floor as well. So we'll come to them. There's somebody else coming in regard to Councillor Duffy would support Darren's deferral. As I say, there is a proposal on the table. The other two speakers that are waiting to come in is Councillor Ferguson, Rachel.
Thank you, Chair, and thank you, DeBarry, for the answer to the question. I don't think I can support Councillor Farrell's proposal. I think it is too big. I really don't want to go to deferral. I know that these advice services are waiting for this certainty, and but I understand that it is a huge thing to talk about. I do think that we are bound by the Commission agreement to go by the formula in which we had. We may not agree with the formula, we may have issues with formula, but we are bound by that, and this is why this top up will cover anybody that's about to lose out. So I'm still in favour of option one, if it goes, but if everyone else wants to go and defer it so we can have this conversation around the working group, I'm happy enough for that. Thank you.
Thank you, Rachel. Councillor Harkin, Sean.
Thanks, Chair, for letting me in second time. I appreciate that. And obviously, this isn't a difficult. This is a difficult meeting to chair because it is very important. Because I mean, I take issue with the idea that we don't fully appreciate the importance of advice services and the work that people do. It's because we understand the work that people do, especially in a district with the deprivation levels that we have, where we understand how much help our advice providers have actually given to tens of thousands of people over the last year and a half. And if anybody has destabilised the sector, it's been with threats of cuts, which have not come from people before profit. You know, that's what's destabilised people. That's what's demoralised people. People sitting worried that welfare advice workers are going to lose their jobs, and people worried that that some of our advice providers would have lost jobs based on decisions that the council was making. And that's why we put through motions in both Stormont and in our council to block that from happening. So we can be proud of our record in standing up for advice services and advice providers and the workers in that sector and the people who depend on those services. So look, you know, I won't be voting for recommendation number 5.1 tonight. Either way, with the deferment or with moving this to 6 months, if we can even get an audit in that period, it is an attempt to try and say we need to look at this more. A number of us are clearly not happy with the on the basis that we've arrived at this discussion, and so you know, none of the arguments I've heard in favour of 5.1 have convinced me. Of course, this is about rolling on the funding. We need to provide security for people's jobs. That money is ring-fenced there. So, you know, the people who are most reluctant about moving this forward are the ones that have stood up, in my opinion, you know, hardest in defence of the sector against cuts, and that's about defending people's jobs, livelihoods, and you know, standing up for the people that depend on the services as well. Thank you, Chair.
Thank you, Sean. Folks, that was all the indicated speakers up till now. And we did get clarity, and again, not to be panicky, we did get clarity around the proposals there from Councillor Farrell, Rory's proposal. It has been seconded by Councillor Tierney. Brian, there was mention of an amendment. Now again, without being panicky, there's no amendment in the chat box. I think the amendment was in terms of the time frame from 3 months to 6 months. So I don't know if anybody wants to address that. Other than that, we will move forward on the actual proposal or motion or put forward by
Chair, can I?
Councillor
Yeah, I thought yeah, I did propose it, but also Councillor Farrell did come in and say he was happy to have it at 6 months. So I'd be happy to formally propose it if necessary to have it changed to 6 months instead of 3.
No, well, if Councillor Farrell accepted it, then that becomes part of his motion if he accepts it. So, folks, on that basis, I want to ask Karen to move to, because if I picked up right and what different people were saying, there's obviously differences of opinion in regards to Councillor Farrell's proposal. So I'm going to ask Karen to move to a vote in relation to it. Sorry, Councillor Farrell, do you see your name there just?
Thanks again, Chair. I'd just like clarity on Alderman Guy's proposal. Is it that he is saying defer any decision until the next advice panel?
That would be right,
Rory.
Rory.
The current funding arrangement stay in place? Because
No, I'm saying if we can get basically deferred all and the quickest we can get a meeting for the advice panel and obviously get the legal service, get Philip to tell us what legally can and can't be done at that stage, you know. If we could get one as soon as possible.
Darren, would it be right in saying that if we went for an emergency meeting possibly early next week and then before full council, we could have a verbal report at full council?
I'm okay with that, Sandra. Yeah.
Well, the SLP is content with that as well, and I'll withdraw my proposal if Sean Harkin withdraws his amendment.
Okay.
Happy to go with Darren's proposal.
Okay, so just to be clear in my own head, Councillor Farrell, you withdrawn your proposal for now anyway.
I am, and the SLP will support the deferral. Yeah.
The deferral, and I think I heard Councillor Harkin there, maybe what's I putting words in his mouth. Was that you,
Chair
Sean?
Morris here, Chair. We have no problem with that. We have enough.
Okay, so it's deferred for.
Here, thanks, Chair. Yeah, I support Councillor Alderman Guy's proposal.
Okay, folks. I don't hear anybody speaking in anything different than accepting Darren's proposal of a deferral, a quick turnaround of a meeting of the panel and coming back to full council. Is that okay?
On a lighter note, Chair, if you would permit me, that U-turn lasted about as long as Evan puts leadership of the DUP.
Boom.
Okay, folks, moving on from that item, the next 9 items are for information, but I surmise that there will be people looking to speak them. So if people maybe take a minute or so to put in what ones that they want to speak to, and we'll try and put them in the order that they're in, if that makes sense. In terms of who's going to speak to what, the matters for information. Okay, folks, if I could, and people still feel free, obviously, they let me know, but moving forward, the first item is item 17, and so far I have councillors Farrell, Tierney, and Doyle. So, Rory, if you want to kick off. Item 17.
Hopefully this, thank you, Chair, and hopefully this is less controversial. Obviously, we welcome the extension of funding for the Community Crisis Intervention Service, but in relation to addiction services in the Northwest, we had an addiction motion passed at a health and community meeting, which was ratified at full council, and it committed to the council writing to various bodies and individuals regarding addiction services in our city and district. One of the pieces of correspondence was sent to the British Secretary of State, Brandon Lewis, regarding the New Decade, New Approach commitment to fund an addiction centre in Derry. I don't remember any correspondence being received in relation to that at any of the full councils since. So I would like to ask for an update. Has anything been received? And if not, could we chase that with the honourable gentleman?
Chair members, just to report, no, we haven't received a reply to that correspondence, so we'll take on board your request for an update.
Is that okay, Rory?
That's perfect, thank you.
Okay, thank you. Councillor Tierney, Brian.
Chair, thank you. And I suppose it's on similar vein as what Councillor Farrell has just raised. And as Councillor Farrell said, we welcome the extension of the funding. But Chair, I've said this in this, both in the physical chamber and in this virtual chamber. I don't know how many times. This is no way to be running a service where it's drip fed funding 3 months after 3 months, and then they stretch it for 6, and all of this year. It's no way whatsoever to be running such an important service across our city and district to support people who are suffering from addiction. It's absolutely scandalous. Not only is it affecting the people who use the service, but it's also having an impact on the people who provide the service as well, because they don't know 3 months after 6 months whether they're going to be in a job or not, and it's absolutely ludicrous. We've seen all week in the media everyone raising the issues of all of the commitments within New Decade, New Approach, and I and my party fully support them. We seen last night at the 11th hour, Brandon Lewis saying that he's going to be bringing legislation through Westminster for an Irish Language Act, which is welcome, absolutely welcome, because it should have been delivered long before now. When are we going to see people jumping up and down about the addiction service in Derry that is mentioned in New Decade, New Approach, which actually is going to impact on people's lives? And I would like to see us continuing to push for a better service first and foremost. And until we get a better service or a more sustainable service, proper funding to allow this service to continue doing the work that it's doing, because it's doing a really, really good job. And the way it's been funded is absolutely ridiculous, in my opinion, Chair. Thank you.
Thank you, Brian. Councillor Doyle, Emmett.
Much appreciated, Chair. And briefly, of course, support the fact that we've got what is stopgap funding for CCAS. And I maybe Karen can clarify for me, but I think it was at last council, or it was at one of the special council meetings that I actually asked for a paper to be brought forward outlining what is being done in the interim between these funding crises. And I don't know whether that's coming to full council or not. Maybe Karen might be able to update me. But to answer Councillor Tierney's question about where are the people jumping up and down about a detox service, look no further, because Tams and White has been jumping up and down about them for months, and there have been regular meetings of the campaign, which I know he's aware of, and he has met her as well as a former mayor. But in terms of the correspondence to Brandon Lewis, I should let people know that the detox campaign has also contacted the Secretary of State to seek a meeting around the funding for this service, because as much as an Irish Language Act is very important, the ability to speak a beautiful language, our native language, is not going to save lives like this detox centre would. And all of the data, we've continually presented it from Minister of Health right down to officials in Elton, shows that we do need a detox service in this city. We're not going away, because if that was the case and we did pack up and go, we would be allowing addiction to further ravage our communities. Now, in terms of just to let members know, and I've been in contact with the Chief Executive about this today, Townsend does want to safely arrange a rally of some description, and I know this was discussed at the closed meeting with Townsend that Brian hosted a number of weeks ago, and we would welcome members' support for that. But it is time for people to get on board. We last week appointed members to a range of internal and external bodies. Many of those have responsibility for health, and we need to be consistently pointing out that this campaign is not going away. And there may well be people, they may be in Belfast, they may be in Derry, who don't want to take this on, and we have to make them take it on. And in terms of, I have to agree with Brian about the stopgap funding for CCIS, and there was a responsibility on us in this council as well to ensure that we are doing everything we can to support them in funding for that 10 million, as part of that 10 million mental health fund that the Department of Health has set up. But with regards to, ongoing around the detox centre, people need to get on board and get on board full time around this, because there are far too many people who are suffering out there. And we as a corporate body, of course, have our own position, but it is time for us all to demonstrate exactly what we're willing to do on the ground to ensure that it becomes a reality. Karen, if you wouldn't mind, if you could clarify that about that paper for me, thank you.
Chair, I don't have all the details of the work that was undertaken. As you know, we had a project steering group around the project with representatives across the statutory sector and involving various voluntary partners. I'm happy to get the detail of that response and bring it to you as soon as I can. I just don't have it available tonight.
Okay, Emmett. Sean, sorry, Councillor Harkin, was it in item 17 that you were looking in?
It is, Chair. Thank you.
Yes. Go ahead, Sean. Go ahead.
Yeah, look, I agree with what others have said. I think that it was vital that we made sure that the Community Crisis Intervention Service wasn't shut down. I think it would have sent the wrong message, and it was very unfortunate that we had to mobilise again to stop that from happening. And I believe it was because we were planning the protest that the message was clearly sent to the Minister and others that this would be unacceptable. So I think that there's a lesson there that people power is the key thing. We can pass resolutions, but we need to mobilise and make it clear that we're willing to campaign and fight for something that we think is important. And if it hasn't already been done, I think we should write to the Minister to ask what the plan is now to find the core funding out of the 10 million fund that he mentioned in the next couple of months, because we don't want to be in September doing this all over again. So if that's not already formally proposed, I think we should write that letter very specifically. How does he plan to provide core funding now to the CCIS? Emmett mentioned the detox service, the detox centre, and I think Townsend, as we've all agreed, has done a brilliant job. I think again, we have to mobilise, so we will be in full support of whatever actions the campaign is calling for. For me, it's not about choosing over Irish language and health waiting lists. I think we have to fight for all these things. I think the lesson is, you know, I don't thank Westminster for passing, for agreeing to bring forward Irish language legislation. It's because there's a campaign that's been relentless. And if you look at all the other things we've won that have been progressive in recent years, that have come from, you know, it's because there's campaigns that refuse to go away. And I think that's the key lesson. So it's going to be the key lesson when it comes to fighting for, you know, vital services for our city and district.
Thanking you, Sean. Sean, would you mind putting that proposal in the chat box, just to see if there's a seconder there, but just to have it on black and white, so to speak. Members, I don't have any other speakers on.
I'm going to do that right now.
Okay, so I don't have any other speakers on item 17, but Councillor Harkin's putting that proposal in the chat box, which has been seconded by Alderman Guy. Okay, folks, Councillor Harkin has put it in, it's seconded. I see a number of indications of support. I'll tell ASC1. I don't see anybody speaking against it. Folks, I'm going to give it a couple of seconds, and if not, accept the proposal. Is that okay?
Chair Morris here, we're happy to support as well.
Okay, Morris, appreciate that. Thank you. Okay, folks, I'm going to move on now to item 20, and so far there's been 2 indicated speakers. Councillor Burke, Tina.
Thanks, Chair, for letting me on, and I suppose just to welcome the sort of findings that came from the assessments that were carried out. But it's just a request, and it's just on myself and Councillor Logue have been contacted by residents in and around the Lowmore Road in the Brandywell area in relation to the mast that has been installed there and beside the stadium. And we were wondering, could we get a similar assessment carried out, just to address and help hopefully alleviate some of the concerns that parents who would use the services down around there. Obviously you have the park, the youth club and the play school in the surrounding area. And then obviously the residents themselves, as quite a number of them have expressed concerns. But I was wondering, could we arrange to get that done?
Chair, I look into that and contact Councillor Logue and Tina just in relation to the possibility of having that monitoring carried out.
Okay, Seamus, is that okay, Councillor Burke? I suppose I'll bring in. Is that okay? If I could bring in the other speaker in this, which would Councillor Farrell, Rory.
Thanks, Chair. And it's obviously on the Ofcom testing of the mobile masts. I think the tests have confirmed what we knew already, that they were safe. In fact, the emissions coming out of them are less than 1% of the permitted levels. I've spoken to a number of the residents that had previously communicated their concerns to me. they're over the moon. They're relieved and they're reassured with these test results. So I'd like to thank Seamus for being persistent and getting these and providing that reassurance for the general public out there. Thank you.
Thanking you, Councillor Farrell. Thank you, Rory. Next speaker is on item 22, Councillor Boyle. Michaela.
Yeah, thank you, Chair. And this is about additional parking at Strabane playing fields. And I suppose it's just to make the comment. And I was speaking to Councillor Rory McHugh earlier. I know he has been on this issue for some time. So I was just wondering, maybe just to ask the officer, Karen, if funding at this stage has been identified, and I suppose if not, could they look at every effort to find it and secure it? Obviously, it's an important issue for people in that area and a rural area also, and we've talked earlier about I suppose the disparity in rural areas, and this is one of those issues. So hopefully the funding will be found soon if it's not already. But want to note the content of the report, and hopefully proposals and costings will be presented in a considerable short period. So look forward to getting updates on that very soon. Thank you, Chair.
Chair, I can come in if, Karen, do you want me to come in? Not have a bit of detail on it?
I'm happy that you go with it.
Yeah, through yourself, Chair, Michaela, yeah, we have rough costings on this of 20 to 25,000 pounds. We've had discussions with the lead finance officer on it. So look, we're progressing with considerable works there in Strabane anyway. The money hasn't been identified yet, and Alfie has suggested it goes forward to, at the end of the quarter to see what savings there will be and be presented. So look, we've identified that roughly the cost, and we've put that forward as an ask. So that'll be identified as in the priority list going forward if the money's available.
Okay, Barry, thanking you and Michaela also indicates her appreciation in the chat box. Councillor Tierney, Brian.
Chair, thank you. And Chair, I appreciate that this report is in relation to additional parking at Strabane, but Barry will be aware, and we've had a number of meetings around a similar issue at Leafair Pavilion, where there are serious parking issues there. There is I suppose it would be fair at this point to call it a draft plan put forward, and in fairness to Barry and all of the officers, the meetings that we have had, they've been very, very useful, and they've all been very attentive and very helpful. But Chair, I would like to see a similar report being brought forward to this committee in relation to the parking concerns at Leafair, because it's not actually too far away from where I live, and I see it right and regular where there's cars parked here, there, and everywhere. And I have a genuine concern and fear that someone is going to get hurt in either the Leafair Park or Leafair Gardens area. And I would like to see a report coming to this committee to outline how we as a council are going to work with the community to try and address these issues. And that's a formal proposal, Chair, please.
Okay, okay, Brian. Barry, is that it's a formal?
Yeah, Chair, through yourself, look, work has progressed. Our capital team have been working with the community around getting access to drawings to submit as planning. Obviously, no budget as yet, so we were planning to bring that up at capital working group as a discussion. But look, happy to bring another report here. That will be a significant investment that will have to go to capital working group as well with regards to the money. But happy to bring the same report through this committee as well, Chair.
Okay, thank you. Is that okay, Brian?
Chair, and just again, they record my thanks to Barry and his team for all the work that they've done. They did. I'm not suggesting that they haven't been engaged. They have been fully engaged in the process, but it's just more to formalise the work that we've actually been going on by bringing a report through the committee. And I hope that the officers appreciate that. That's the reason for the proposal.
Okay, thanking you. Members, I don't see any further indications to speak on any of the matters of information or the remaining matters of information. And if that's the case, could I ask for a proposal again to confidential? Please.
Proposed, Chair.
Thanking you, Brian.
Chair.
Thank you. In terms of confidential, folks, it's matters arising